welcome you all to Saroj Naidu Vanita Pharmacy Mahavidyalaya.
A warm welcome to all the freshers.
Myself Mirza Fatima of Family 4th year.
I am Afsha of Family 4th year.
On behalf of management, staff and students of this college, I invite all students and their parents for today's much awaited orientation program for the academic year 2022-2023. I request Malavya to present floral greetings to our chairman.
Appaji Garu, former Director General, Farm Excel, to come over to the dais. I request Lisa to present floral greetings to our chief guest. Invite our honorary treasurer Sri V. Jayaraj Garu to come on to the dais. I request Shrestha to present floral greetings to our honorary treasurer sir.
I now request our director Dr. N. Srinivas sir to come on to the dais. I request Brighty to present floral greetings to our sir. I now request our Vice Principal Dr. T. Mamta ma'am to come on to the dais. I request Pranita to present floral greetings to the ma'am.
Your turn. Your turn.
It removes the forces of darkness and gives us positivity.
I now invite all the dignitaries on the stage to proceed for lighting of the lamp.
Invoke the blessings of Lord Ganesha and Goddess Saraswati with a prayer song by Mamta and Saipriya.
गाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि.
All the students for choosing and joining this prestigious institute.
This orientation program is meant to give information about our college and provide clarity about your chosen profession.
It's an opportunity to meet new people and make new friends.
I once again congratulate you all for your sincere efforts and hope you will enjoy your stay in this institute. N. Srinivas sir to give welcome address and brief about our college.
Respected Chief Guest of today's Orientation Day 2022, Dr. P.V. Appaji Garu, retired Director General of Pharmaceuticals and Export Promotion Council, Pharmexip, Government of India, Ministry of Industry. Respected Chairman of the institution, Dr. B. Prabhashankar Garu, and respected Honorary Treasurer, Sri V. Jairaj Garu, and my colleague, Dr. Mamata Madam, Vice Principal, and Dr. Sarita Joshna, who could not make it because of her personal family schedule. I, Dr. N. Srinivas, Director, on behalf of the management, staff and students, I take the privilege of extending a warm welcome to all the students joining our institute in B Pharmacy course and PharmD course. I also welcome the parents who are accompanying their daughters, and I also welcome the governing body members, members of Exhibition Society, Economic Committee and OG. And today, at the outset, I congratulate all of you for choosing a right institution and a right profession of pharmacy. We'll come back to this once I finish this speech. Why it's a right institution? Why pharmacy institution, pharmacy profession is a right profession? We'll come back. So at the beginning, let me make it a strong point that a nation's progress, development depends on how well the women's safety, welfare and rights are protected. Especially in particular, women's education, where the development is there in a country, that country develops. And our sponsoring and managing body, Exhibition Society, decades back, they have realized and they are contributing to the society. Today, we have 18 educational institutions exclusively for women. So, Exhibition Society has felt the need of women's education decades ago, and our chairman sir is the right person to enlighten you all when, how and what the society has done for the women's education. And why nation? If you look at your own family, if the woman is educated, the family progresses. I am sure everyone agrees about it. And when I say education, it's not about the qualification or percentage marks. The woman in the family learns by experiences. So, women's education and your institute or our institute is exclusively for women. So, that is first thing that I want to stress upon, the women's education. Then, coming to the pharmacy profession, we have got the best person again, Dr. P.V. Appaji sir, who started his career as drug inspector way back in 1970 when I started my first class. He is the right person who has witnessed at all levels how the pharmacy profession has progressed. And to be in brief, the pharmacy profession, the core and frontier fields are expanding at rapid pace. Whether it is the core areas like manufacturing, quality control, formulation R&D, innovation R&D, regulatory affairs, apart from this core industries like Sun Pharma, Reddy Labs, Natco, etc. The other areas which are rapidly expanding include the areas of clinical trials, pharmacovigilance and data management. It's not just the data science of the engineering department, but even clinical data science is one of the hot emerging areas. The medical writing fields, medical coding, enormous expansion is happening in pharmacy profession. The pharma market, which is more than a $1 trillion US market, 1 trillion, the global one. And further statistics, I request our chief guest sir to appraise the students to know the clinical research industry which I was talking about, IT enabled pharma sector. It is again around 120 billion US dollar market globally, and our Indian market is around 1 billion US dollars. And the scope for the new molecules development is improving day by day. So besides all this, how Vanita Pharmacy Mahavidyalaya has emerged, let me brief about that. In 1997-98 academic year, Sarojini Naidu Vanita Pharmacy Mahavidyalaya commenced its operations. In the exhibition grounds campus, we were occupying complete ground floor, and the complete amenities of the exhibition grounds were utilized, and our institute was inaugurated by His Holiness Jayendra Saraswati Swamiji and Vijayendra Saraswati Swamiji way back in 98, and decennial celebrations were celebrated with Honorable Venkaya Naidu Garu, ex-Vice President, and this new building in 2014 we have inaugurated, and Honorable Chief Minister of today, K. Chandrasekhar Rao Garu, has inaugurated this new building. So in 97-98 we started with B pharmacies, just 60 intake, and later on upgraded it to 100 intake. I was there right from the inception of the institute, so I can brief you. Each and every piece of the instrument which is purchased in all the labs were purchased from best of the best suppliers. We take comparative statements, we choose based on not just the cost but also by quality. We have established all the labs required for B pharmacy, which everyone has, but we upgrade them from time to time. For example, HPLC is one machine. During 2000, I think, we have purchased it at 10 lakhs, and we have upgraded that with new machine from, with a new software with 15 lakhs in 2016. Like another costly machine called as FTIR, we purchased Perkinelmer Brink long back, and again the new version we have purchased 5 years back. It's not like only two machines, UV visible spectrophotometer, many other machines. We have changed them. We have added in some cases, we have changed. When it comes to the brand of the instrument, we never compromise. Like tablet making machine, we purchased CAD-MAC make, which all the companies also use the same CAD-MAC make. So we have got industry size machines also in manufacturing lab to appraise the students, to give a simulation. And you might have seen, we have a simulated medical shop, virtual pharmacy also in our campus, in the ground floor. Some people, some parents, when they approached me, they got confused. Medical shop also we run, they thought. But around 2,700 brands we have, but only cartons are there, inside medicines are missing. Okay, and all categories we have, and we have kept everything in Excel file. You can, when time comes, you can sort out them according to company wise, therapeutic category wise. This sort of virtual pharmacy is not there in any other college to my knowledge. Maybe few colleges outside South India maybe. But here the point of my emphasis is not about a machine's upgradation or about a virtual pharmacy per se. It is the thinking, how we are trying to train our students, the visionary management who thinks of giving the best, nothing less than the best. So not only in the infrastructure wise, even the faculty. We have 16 PhD faculty in our institution out of 46 total faculty. As per OU norms or as per AST or TCI norms, even 6 PhDs may be enough. But I don't want to take much time because it's a rare opportunity for the students or the faculty to listen to a person like Dr. Appaji Garu, who started his career as a drug inspector way back in 1975, who has witnessed the growth of the pharma industry in India and how he has taken it to the globe. So I don't want to go into the club activities, but all the club activities, only one thing is very important to understand. Normally a student who joins in first year, they have a company of some 50 students in B Farm section and 30 students in Farm D section. While leaving also, their best friends are only in that 30 or 50, unfortunately. But in our institution, we have the activities in such a way that all the students who are interested in group discussion, all the students who are interested in fine arts or the film appreciation club or several other clubs, the students who are interested from among all the batches, they come to one place every week and they interact with each other. That makes them perfect in their communication skills and all that. Now you tell me the first point. I come back to the same. Right college and right profession. How many of you agree? Not by raising hands, but by clapping. Okay, it's audible to us, but half of the Sarojini Naidu Anita Pharmacy Mahavidyalaya stays in hostel. It is a wrong on my part if I don't mention about the hostel. The hostel provision, I have not seen in my 25 years of my experience in teaching, I have never seen a hostel of this nature. People don't bother at all, but our management has taken steps that the hostel is so excellent. So let your applause be known to the hostel students also. Let them know that the first years of B Farm and Farm D has arrived in the campus. All the students and their parents, to the family of Sarojini Naidu Vanitha Pharmacy Mahavidyalaya, thank you very much.
Thank you, sir. I now request and invite our chairman, Dr. B. Prabhashankar Garu, President IPA Telangana State Branch, to
Good morning, ladies and gentlemen. Respected chief guest of today's orientation program, Dr. B.V. Appaji Garu, former Secretary General, Pharmexil, and my fellow colleagues on the dais and of the dais, respected teachers, respected parents, and dear students. On behalf of Sarojini Naidu Vanitha Pharmacy Mahavidyalaya, I extend a warm welcome to all the dignitaries on the dais and off the dais and everyone who is present today here. Sorry, I had a sore throat. And a warm welcome to the students of B Pharmacy first year Farm D first year. First of all, thank you very much for choosing our institution to graduate from here. And also, we thank the parents for choosing our institution and having confidence on the institution management and the staff for admitting your child here, where she has to stay for minimum 4 years in B Pharmacy and 6 years in Farm D. So this 4 years and 6 years journey is a very long journey. So, dear children, or for me you are all children. Dear students, you are leaving your parents today, your mother, joining another mother here, because educational institution is nothing but it is a mother institution. So you have chosen our institution as your mother, where you will be nurtured, trained, and you will be taught how to live in the future, what to do in the future, how to be successful in the future. So the parents are handing over you to us for the long journey of 4 years. These 4 years, let us come together and learn the profession of pharmacy. This is a noble profession you have chosen, as without pharmacy, the healthcare system is not complete. There are doctors in the healthcare system, there are nursing profession is there, paramedicals are there. Many professionals are involved in the healthcare system. But the most important one is the pharmacy profession. So you have chosen the right profession which serves the humanity. So from the day one you start thinking that you are going to contribute something for the humankind, either by way of research, finding new drugs in the future, developing new drugs, or serving the people by way of the pharmacy profession. There are many ways, there are many facets of pharmacy. Unlike other professions, like if you do medicine, you have to only practice as a doctor. If you do engineering, you have to work as an engineer. But this is a profession of pharmacy where you are involved in various professions. You are a part of various professions. So we are here to educate you. Our teachers are there. They are well qualified, experts. in their own field. They will guide you in this 4 years journey. Please pay attention to your teachers. Your teachers are feel like they are your mothers. They'll teach you like that. And learn from them. And try to excel in improving your knowledge, the basic knowledge, foundation. They will lay the foundation in you. And this foundation has to be very strong, because entire building, if you say, depends upon how you lay the foundation of that building. Same way, here are the teachers waiting for laying a good foundation, a strong foundation, by giving the right knowledge to you in this 4 years and 6 years journey. But all this thing can happen if you are interested. Show your interest. I am sure that you have chosen this profession of pharmacy not by choice, by your own interest. If you have joined as there is no choice, if you feel that you have missed the bus of MBBS and joined our pharmacy profession, try to stay in the same profession for the next 4 years. Believe it or not, you will remember my word that you have taken the right decision. Try to keep your mind focused. Now, no more thinking of, I have missed MBBS, I have missed agriculture, I have missed this, I have missed that. I wanted to do this course or that course. Forget about those things. Now it is a journey. You have to reach the destination. You have chosen this route of pharmacy, where you have to be in the same route. Your teachers will take you to the destination. And there is no unemployment in the pharmacy profession. You can choose your own job. The jobs are waiting for you. Only thing, how it depends upon how you choose the profession of pharmacy. Once you join, once you start attending the classes, you will come to know about what are the facilities or career options available for you once you graduate from here. We will try our best to impart the knowledge required to graduate from here. But the same hard work you have to put in. So it is shaking hands with your teachers, stay like friends, learn jovially, enjoy the 4 years days here in the company of your teachers, your friends, and forget about the facilities. The management is there to take care of that. We want only our students to excel and make us feel proud that our students have achieved the greater heights once they graduate. And today, you take any profession, technology is changing. You have to be up to date. Every day there is a technology changes. As you see mobile phones, every year you feel like buying a new Samsung or Apple phone because they have changed the model. They have brought in with the new features and you are more attracted to that. And you put pressure on your parents. Buy me the latest model of Apple or Samsung. The same way, the technology is changing in the pharma field also. In all the facets of pharmacy, the technology is being involved at a very greater speed, and we ourselves have to be up to date. And therefore, you are not going to stop learning after your graduation. The learning process will go throughout your life. Every day there is a learning. Every day there is something new. So in the future, you have to gear up and await for the new things where you can update yourself and be on the right job. You have various avenues once you graduate. You can become an entrepreneur. You can have, if your parents are very rich enough, they want to invest money, you can start a manufacturing unit or you can enter into pharma business. If not, you can choose a job in various fields. Nowadays, you don't have to ask anybody, just get into Google, you'll come to know what are the career options available for you in future. Whatever you do, whatever you choose, now you have chosen pharmacy for 4 years. Then after 4 years, you will have another question. Your parents will have, what next? Either go abroad or do PG, post-graduation, or go for a job. So at that time, our teachers will help you, guide you, and help you out in choosing the right profession. But till 4 years, don't think about what you do after 4 years. Please think about what you learn here. Try to become perfect. Pharmacy is not a theoretical job, it is a practical job. Once you enter the industry, you will see. When we take you on a tour to the pharma industry, you will realize how big is the pharma industry. So please, I request you to concentrate, focus on the studies, and you can always learn to ask questions to your teachers. Don't hesitate in asking questions. Unless you ask questions, you will not improve your knowledge, neither you can update your knowledge. So make it a habit of asking questions to your teachers. Don't be afraid of asking questions. we welcome you. And you can regularly give feedback to the institution. If you have any suggestions, if you have any complaints, you are free to approach the principal or the director and talk to them. We are here to serve you, we are here to help you out. And we are all in the management of this institution. We are not employed. We are serving the institution on our own interest by being the members here. And we have in all our educational institutions over 30,000 students studying. We employ over about 2,500 teachers throughout Telangana. We are not less than a university. So we have to manage 30,000 students is not a joke. But we are doing it, and all based on the free service we are giving, social service we are giving. Our institution does not charge any management quota fee, additional fee. Either if you are joining through management quota or through MSET convener quota, the fee is the same. We don't collect any additional fee because we are here to serve the society. We are here to impart good education, which should be appreciable by all in the society. So, I wish you all the best in the next 4 years of your B Farm or 6 years of your Farm D. And our institution is known for its academic excellence. Not only we depend upon just taking classes to the students theoretically, we invite the experts from the industry, from various professions to come over here and address the students. So, and we do seminars, workshops, and many other activities of excellence in academics so that the student gains knowledge from various means, not only just by attending the class. And our teachers are trying their best to give you, to share their knowledge with you. So, I assure the parents that your child will be safe in our organization as long as they stay here. And I'm sure if you have any issues, please bring it to the notice of the management. We can find a solution or solve the problems. So with this, I wish you all the best to the incoming freshers or the first year students, and we'll be interacting soon on various occasions for the next few years. Thank you very much.
Thank you, sir. Now, Afsha will introduce our chief guest.
It is my privilege to introduce our today's chief guest, Dr. P.V. Appaji Garu, former Director General, PharmExcel. Dr. P.V. Appaji has done his graduation, post-graduation and doctorate in pharmaceutical sciences from Nagpur University, Nagpur, India. He started his career in 1975 with the Drugs Control Organization, Government of Andhra Pradesh. He joined Government of India at New Delhi in 1981 and worked in various capacities as Technical Officer, Deputy Director, Deputy Development Commissioner, Ministry of Chemicals and Fertilizers, and Director in National Pharmaceutical Pricing Authority till June 2003. Later in July 2004, he was sent on deputation as Executive Director to the newly set up Pharmaceutical Export Promotion Council of India, PharmExcel, under Ministry of Commerce, Government of India, as Founder Executive Director. During the past 2 decades, he visited several countries as Senior Government Officer as part of Indian Pharma Promotional Responsibilities by Government. He was selected as a WHO Fellow in 1986 and was trained in USA and Canada. He made several international presentations at WHO Geneva, USA and other countries on drug price control mechanisms in India. He is the Founder Executive Director of PharmExcel. During his 13 years period in PharmExcel, Dr. Appaji had actively contributed in the establishment and strengthening of the newly set up started by him. He had taken several delegations of Indian pharma to countries like Japan, France, Russia, South Africa, China for trade promotion and interaction with agencies. He started IFEX, now a very big and popular annual international ex-pharma during his period, had grown from about rupees 17,000 crores to rupees 1.16 lakh crores. He known as friend of SMEs and worked for their entry to global export markets. Hundreds of benefited SMEs who became successful exporters fondly call him as Bhishma Pitamaha of Indian pharma industry. To his credit, he has many publications and research articles. He has been honored with Eminent Pharmacy Graduate Award by Indian Pharmacy Association, Hyderabad, and Lifetime Achievement Award 2012 by Hyderabad Association, New Delhi, and prestigious Professor M.L. Khurana Lecture Award 2013 by Indian Pharmaceutical Association. He is also the life member of several eminent associations like IPA, IPGA, etc. His hobby is sharing of pharma knowledge through regular news updates. He is active with his updated postings on national and international pharma matters on LinkedIn with several thousands of followers. Currently, he is Honorary Advisor of Bulk Drug Manufacturer Association of India, Member of Central Council, Andhra Pradesh Pharmacy Council, Independent Board Member of some pharmaceutical companies, Chairman of Pharma Manufacturing Company, Advisor to some universities, colleges and pharmaceutical companies. His contribution to Indian pharma industry from the day one of his career is significant in quality control of drugs and pharmaceuticals, policy level discussions or amendments, steps taken for export promotion of drugs and pharmaceuticals transform the Indian pharma industry to heights. I now request and invite our esteemed chief guest Dr. P.V. Appaji Garu, former Director General, PharmExcel, to address the gathering.
Respected Dr. Prabha Shankar Garu, the chairman of this most reputed organization, Srinivas Garu, Director Garu, Madam, and Jayaraj Garu, Treasurer, most admirable staff, teachers, and real great attraction and happy thing today the students, newly admitted students to pharmacy college, and the parents. It is a new thing, and I am very happy to see parents of children also here for the first year who have taken admission to the first year B Pharma and Pharm D courses. It is a happy occasion to say to you that I am recollecting about 50 years back when we started our B Pharm as a student somewhere in 1967. Just kindly recall where I started, and when I was a student of B Pharmacy in 1967, I took admission in Nagpur, completed. And likewise, as Dr. Prabhashankar Garu was telling, the same thing, why you have come to pharmacy and how parents struggled with their view. What is pharmacy? What is to be done? Whether I should send my child to pharmacy course or not, whether a student go and try for your medicine, then you go to pharmacy in most of the cases. It happened with me, and it must have happened with all seniors here, and also it must have happened with students who have just joined, and also parents. Now totally a different framework of mind. Parents think that my child should go for a better course, for a better fortune, for a better future. This is the status, and thanks to Prabha Shankar Garu, a most respected person of our profession, having invited me to share this and to be chief guest here. Particularly, I would like to tell the students, newly admitted students, and parents who are here today. To begin with, your child is in a safe hands, and you have taken a right decision. And having been a female child, and this college takes only girl students, and they are extremely lucky, I think, in coming to this institute. I was discussing with Prabha Shankar Garu, a pharmacy college of this level, this facility, this structure, and such a good staff is something very, very, very good. And you must feel that the first step in bringing your child to this course, to this college, is a highly, highly right decision, and you are all fortunate. Students are fortunate, parents are fortunate. You have come here, and they are going to be excellent future scientists or professionals of pharma. Now, let us come to why we have come, and what is this pharmacy, or what are the advantages in coming to this. As I said, that most of them maybe today or even my days, but what is pharmacy, what is the benefits of this pharmacy. I want to tell the students, youngsters who have come here, to remember only one thing. Parents also come to know this. If it is a disease, yes, it is a doctor. We have to go to doctor, and we have to go by his advice. Now, after doctor, what happens in our life? Every time the most required thing is health. Every one of us face it day in, day out, either for parents or for us or for our children. After doctor, what it comes is medicine. Doctor cannot do anything without a medicine prescribing to his patient. Now our role starts, a pharmacist role starts. Medicine means particularly in Indian conditions, I am not talking global scenario, and it is a different scenario for a pharmacist in a different way. But in India, if after next to doctor, when we call, when we talk, when we think, when we go, it is medicine, and medicine means it is completely a pharmacist domain. It is a completely pharmacist domain, and you are the real pillar, backbone. Any patient, anywhere, 130 crores, 135 crore population of India, or even 400, 500 crore population of the globe. I am proudly telling, please note this point. It is not only India, and for the whole world, 120, 130 countries, at least 70% of the medicines, 60 to 70% of the medicines, in terms of quantity, in terms of numbers, they are taken. 90 to 95% of medicines taken by our 130 crore population, or at least 60 to 70% of medicines in terms of numbers consumed by patients all over the world, they are made in India. Please remember this. Having toured at least 70 countries on behalf of Government of India, as a pharmacist, I have gone through, I have seen, I have promoted, I have understood, and I proudly share this fact that you are one of the pharmacists who are contribute to this requirement. 95% of the population in the country and about 60 to 70% of the population in the world, Indian pharmacists, they make it, they sell, they distribute it, and they make it available to the people of country and to the people of the world. Can anybody expect anything greater satisfaction in life that I am part of this medicine which is consumed, which is treating diseases by of Indian population or global population. This is the greatest satisfaction, happiness which we all feel, and I take complete extreme pride that I am a pharmacist. God gave me this opportunity, and I have contributed, and my profession is contributing, and my juniors who are entering, they are going to contribute to this excellent profession of pharmacy. I happily share you, not only me, I have taken my son, who is now 25 years old pharmacist, having done his MS pharmacy in US and contributing to the profession of pharmacy. Now, what is this? Okay, medicine is ours, the disease is doctor, and medicine, wherever medicine is said, it is for a pharmacist to handle. Now, medicine means medicine making, and medicine storing, medicine distributing, and medicine selling. Entire line of students and parents, please remember what is your child going to handle. Medicine file is your child's line. And where you want to put your child, where the child now who has started career or education in pharmacy has to think. If you want to make a medicine, then you will go for production. And this is not the scenario in other countries, as I am telling. And pharmacy profession is totally defined or started in a different way, but fortunately it has taken a different shape in India. And most of the pharmacists are going for manufacturing. And as I said, that our India-made pharmaceuticals medicines are usually consumed in India and also in the world. Therefore, first line of opportunity available for kids or for beginners of pharmacy, what you have to remember is that a manufacturing activity is available. Then what is the next line? How do you distribute it? How do you sell it? How do you make it? These are all your lines, and that's why you can enter into trade, and you can be a big trader starting from a pharmacy owner. Here we call medical shops, but fortunately they are most respected term, most popular term chosen in the world is a pharmacy. You can be a pharmacist, you can guide your patients, you can disperse your tablets, you can store your medicines. Then if you want to go for manufacture, and where India has become the real big hub, and India is known as the pharmacy of the world. As I said, that this is the word coined by Government of India, accepted by whole world, accepted by Trump, President, US. Most of the parents must be knowing, students who are with their staff members, respected teachers. We have all observed that without India, the entire globe was shaking. Whether what will happen during COVID time, how we will survive, whether India will give us a send the tablet or not. Most of you will remember that chloroquine phosphate, which is manufactured in abundant quantities in India as the most cheapest drug, which has saved our lives of our people here. Trump was telling, India, I depend, and I am looking to India, and chloroquine phosphate of India saves my life. That is the same word by our Brazilian president, same one by our European ministers. Everybody recognize that India is capable to produce these medicines, and without India, they came to the conclusion during COVID time, the survival of the world was at stake. This is the portion that has happened. Now, why this and what are the opportunities? Now, when I say that medicine is your domain, and when you call medicine, it is your right to say that I am the man of medicine. And when you call medicine, then you are expected to know what is this medicine, and you are expected to know how to make it, how to store it, how to distribute it, how to sell it also. Now, in making of the drug, now the pharmacy students, you are you have just started your education here. What you are going to learn with these most eminent staff, teachers of this college under Dr. Srinivas' guidance, and Dr. Prabhashankar as a chairman of this institute, a great support you will be getting. Then if you want to make it, how you make it, what are all the requirements, what is a drug, how a tablet is made, what are these bulk drugs, what are the active ingredients of the bulk drugs, how do you make that bulk drug, which is API, what we call active pharmaceutical ingredient. How do you make it? Synthesize it. How do you synthesize it? Develop a process. Then it is pharmaceutical chemistry. You try to identify this. For this disease, this is the molecule, and for this disease, this is the tablet, this is the syrup, this is the ointment. You will decide which form, which dosage form you have to give it. If the dosage form is known, how to synthesize it. The role of pharmacist starts, and when we say that we are the people of medicine, then we have to identify which is the drug. We have to manufacture, we have to develop a process for manufacturing that, and then we have to make a bulk drug. After making the bulk drug, how do you use it? How do you make a tablet? Then again, several sciences are involved in that. Then making of a drug, and then make the strict parameters. Is the drug, is the tablet effective? Is it stable or not? What are the impurities they are there? How the patient is going to be there? If unknowingly, as pharmacists who are all going to develop, I always try to share that with my teachers, fellow teachers, and also students. Your most responsibility, big responsibility lies here. Am I contributing to the making of a good medicine? And is that medicine I made, is it working? If you make a tablet, if it doesn't work, if it doesn't dissolve, if it doesn't reach the blood, if it doesn't act on it, or if it has overaction, if it is toxic and the patient dies, sometimes unfortunately these things are happening. And for everything, responsibility lies with the pharmacist, who has made the drug. These are all the requirements which we do, whether if it is an injectable, is it a sterile product? If it is not a sterile product, what will happen? If you are adding bacteria or contamination to the body, hundreds and hundreds of people will die. What is the responsibility there? If you make a tablet which is not working, which is not available, where bioavailability is not there, what is the fun? You take hundreds of tablets every day. Your mother falls sick, your father falls sick, and you have a diabetic, you are like me, diabetic patient. We take tablets and that doesn't work. And the pure doctor doesn't know, the people outside do not know, but maybe we are culprits as pharmacists. We may be culprits, because if it doesn't act means we are responsible for that. We have such a big responsibility in making of these tablets. And now another thing, it is not only synthetic, you have your role to particularly utilize our, I was recently in a Ayurveda hospital. I realized that 3 weeks I was under treatment, and I was closely observing. I have contributed so much to pharma, and I have understood what is pharma. I have understood how these manufacturers are doing, where we have got advantages, plus points and minus points. I had that all respect for Ayurveda, but every time I was fearing that whether the drug they have used is of pure grade, whether the tablet they are giving to me is standardized, tested, whether it is having the same medicine claimed in that or not. But unfortunately, thousands of years of our Ayurveda treatment is, I am beneficiary, I am very happy with that, but that feeling remains in me that what I am doing, whatever Ayurveda they are giving is of perfect standards or not. But now it is an opportunity for the pharma, like you who are joining, you are coming into this line. Take advantage of the thousands of years old science available in the form of herbal or in the form of Ayurveda. How to make a safe drug out of it in the best possible standards as per the highest scientific knowledge you have gained in the pharmacy colleges. That opportunity is there. Now, India, as I am telling, we are giving drugs to Indian patients and also to the global patients. Huge export opportunities are there. Our medicines are going up to even 120, 130 countries, including our so far sophisticated markets like America, US, and also European and other countries. Then how to really utilize this opportunity as youngsters? It is not only production line, as I have started Pharmexil and gave support to Indian manufacturers to take it to global levels. You can avail that type of thing. You can be a manufacturer, you can be a promoter of Indian pharma in overseas countries. You can happily go as a marketing person, either in India or outside, promote and convince the authorities in your foreign countries, establish manufacturing units in those countries, and become a strong manufacturer and also contributed to that country also. That is also possible as a pharmacist with a strong pharma background. There are abundant opportunities, and I always feel proud. Again, as I told, I am trained as a pharmacist. I worked as a pharma price regulator. People wondered in the Delhi when I was working in the ministry, no, he's a pharmacy man, how does he go for pharmaceutical pricing? Yes, we have shown. We know the subject, we have the scientific background, and we used to fix prices of medicines for whole country as part of National Pharma Pricing Authority. Yes, pharmacists can do that. We can fix prices. We understand costing. We understand engineering. We understand pharmacodynamics. But like price control, again, opportunity given by Government of India. As a pharmacist to me is to promote Indian pharma in the global markets. Even now, Mr. Uday Vaskar, who is the Director General, he is a pharma man. Normally people question. They were all thinking that it is not the role of a pharmacist. But as a pharmacist, because of our background knowledge, because of our multidisciplinary scientific and business understanding, we could understand and we have developed. And there is an institute called Pharmaceutical Export Promotion Council of India, Pharmexil, where I retired as a Director General. with our pharma background, with our pharma specialty, we could convince the overseas countries, talk about the quality of the drugs we are manufacturing, emphasize about the prices we are giving at which, emphasize about the patents, violations and others. As a pharmacist, we have complete thorough knowledge on these things, convince them and promote. Today, small manufacturers and also big manufacturers, Indian companies, they are going to the world, they are supplying these things. You can play a role as a research scientist, like you can be an inventor, you can become an innovator scientist, develop a thing and get the awards as a scientist who have developed a drug, and then develop a formulation development and how to increase its availability, how to make a modified drug release, how to make a complex drug release formulations. It acts only for 1 hour in a normal way, but scientists, pharmacists makes it 24 hours. Doctors cannot do that. Any other scientist can do that. But 1 hour activity drug, we as a pharmacist with our science background will make it 24 hours. And now that plants are available, so many botanical plants are before us. And as I said, Ayurveda is not is a different type of science. But we can go for botanical molecule. What is that biomolecule which is active? Even in the animals, what is that biomolecule which is very active? Develop it and make a formulation out of it with purity and without any toxic effects and without any side effects. Likewise, hundreds and thousands of opportunities available to Indian pharmacists, and they required, when at our time when I was recalling, we were 20 students in a pharmacy college or in the pharmacy department. Today, hundreds and thousands of colleges, students are coming out. Opportunities are plenty. At our time, if we have to think of a job, it was only Bombay or some 5 or 10 drug inspector posts. These were the opportunities. Today you see hundreds, thousands, what are the role of regulators, how do they control it? And you can become a manufacturer, you can become a distributor, you can become a promoter, and you can develop one, you can take patents. Likewise, so many opportunities are there, and for financial purposes, you can gain. You have seen Dr. Reddy's, you have seen Heterolabs, a scientist who was there in thing, and today how MSN Labs is there, Dr. Laras is there, they have become world famous. They are #1 manufacturers of the world. We are fortunate to say that they are part of our Hyderabad. They are part of our Telangana. How did we develop the COVID vaccine? Bharat Biotech. For the whole world, they all are pharma companies. They all are based on pharma scientists. And no, I do not want to explain more and more, or there is no limit to that. This is an extremely big opportunity. That opportunity is coupled with an institute like Vanita Mahavidyalaya here, Vanita Pharmacy College, with such a beautiful facility. Now, I have not expected, let me be honest, Dr. Prabhat Shankar Garu, when he was telling and when he gave me this opportunity, I was looking into this college. Dr. Srinivas and staff, I found that they are very knowledgeable and innovative ideas of starting a virtual pharmacy and others, and also having a very good laboratories and having equipment, lakhs of rupees worth of HPLC and others. As he was telling, you don't expect these type of things in a pharmacy college in a normal way. As I happen to work as a central council member for Pharmacy Council of India. Now, Prabhat Shankar Garu is a reputed personality in pharma profession, pharma sector, president of pharmaceutical associations, working I got a lot of exposure to global multinational companies. With that knowledge, he is guiding this institute, and these are money rich exhibition center. It is not a profit motivated organization, and their service motto is very, very evident. The students who got admission have got a beautiful residential complex. What more is needed? And really, the first thing has you have really taken a good decision to bring your children to this, and you have taken a good decision to bring them into a profession called pharmacy, which is nothing but the real greatest science of the world, which involves with our health. And our children are going to contribute to that in this college with this type of atmosphere. Entering into this type of a profession is an excellent decision. I appreciate and congratulate children and parents, and my best wishes and blessings to all the new children, students who have come to this college for this purpose. Thank you very much. Thank you very much.
Thank you, sir, for
Yeah, I extend a warm welcome to the parents and students who have come a little late, and sorry we couldn't wait as we have to start the program on time. Our deliberations in the morning, but in the afternoon session our staff members will brief you about our institution and the various facilities available with our institution, and take you around to the field of careers in pharmacy. And now we have informed you about our institution, about our background, about our infrastructure, all the information we had given to you since morning. You were patiently listening to us. Now it's a time for us to listen from you. So please be frank, bold enough to tell us why you chose this institution to study B.Pharm and PharmD. I want to hear from the prospective students here, and please share with us either, and also I request the parents to ask us any questions, whatever is there in their mind, any doubts about the profession, about the institution, we can answer you. So please, to the staff, okay, I will choose a student and student has to answer me. Okay, the first row with the back, green. You tell me why you chose our college.
It is a good college, sir. So many
Walking.
So many members thought it is a good college to choose this thing, sir. And here it is having a good education is here in this college, sir. So I chose this college.
So somebody told you, or you have gone through our website or information in the website of our college?
No, sir.
Or did your parents?
Some people were told, sir.
Huh?
It is a good college to select this thing, sir.
Okay. And you are from MPC or BPC?
By BC, sir.
By PC. You attempted MBBS?
No, sir.
You only chose directly pharmacy?
Yes, sir.
So, please give her a big applause. She has chosen pharmacy as a profession to her. So wish you all the best,
Thank you.
dear student. And okay, here there is one.
Good evening, sir.
Soumya. I was chosen the B.Pharmacy. I think it was a good opportunity to me, and this college was suggested by my parents, and I also thought it's a good, and there is a future by this college, and thank you everyone for giving me this opportunity.
Thank you. You are also from BPC?
Yes, sir, I'm also from BPC.
Good. Okay, now next is white t-shirt with a black mask.
It's good.
Speak little loudly, everybody can hear you.
My friend suggests me this, and I choose this. I think it is good. My friend also here, she suggested me, and I want this, and I choose this.
You are from Hyderabad?
No, I'm from Mizoram.
From Mizoram?
Yes.
Oh, very good. So, from Northeast India, we have chosen our college for education. Thank you very much.
Thank you.
Any other students?
Myself, I'm Sri Vaishnavi, sir. I have chosen Form B, and my parents suggested me, so I'm also interested to join this college.
You are choosing Form D.
Yes.
Okay, good. Thank you very much. And your parents have chosen, or you know about this college
Parents.
through website?
Parents suggested.
Can I ask a parent why they chose our college? What made them to choose our college? Your parent?
I'm also one of the diabetic patients.
Hmm.
So she is very much interested in this way of pharmacy.
తెలుగులో మాట్లాడమ్మా.
నేను ఒక డయాబెటిక్ పేషెంట్ తను మొదటి నుంచి అంటే నాతో హాస్పిటల్స్కి వచ్చి అక్కడ చూసి నేను తీసుకుని గ్రూప్ సెలెక్షన్ చేసుకుని చెకప్స్కి దానికి రెగ్యులర్గా తను వచ్చాను. సో దానికి ఫార్మసీ అనేది చాలా ఇంట్రెస్ట్.
ఈ ఫార్మసీ గురించి ఎవరు చెప్పారు మీకు? Oh, now I know. Okay, thank you. So please go down the line and ask any questions. Now go and ask your juniors.
Anyone from back can come?
Myself, I'm Likita. Good placements are provided in this college, good facilities, good education, and other external activities are also were provided in this college. So I like this college. Thank you.
Good, good.
సార్ నేను ఒక పేరెంట్ని అయితే మా ఫ్యామిలీ అందరూ స్టూడెంట్స్ అందరూ ఎంపీసీ తీసుకున్నారు. కానీ మా చైల్డ్ మాత్రం తనకు 8th క్లాస్ వరకు మ్యాథ్స్ అంటే చాలా ఇంట్రెస్ట్. కానీ తర్వాత 8th తర్వాత ఒక బైపీసీ టీచర్ బాగా చెప్పింది. అప్పటి నుంచి దానికి బైపీసీ అంటే చాలా ఇంట్రెస్ట్ వచ్చింది. నేను కోర్స్ చేసిన ఎంపీసీ తీసుకోమని నేను అప్పుడే 10th, కానీ తను తీసుకోలేదు. సరే తనకి ఇంట్రెస్ట్ ఉన్న ఫీల్డ్లో తీసుకుందామని చెప్పి బైపీసీ తీసుకున్నాను. నీట్ రాసింది కానీ 2 lakhsలో ర్యాంక్ వచ్చింది తనకి. సరే తను ఇంకా ఫార్మ్ డి అంటే బాగా ఇంట్రెస్ట్ చూపించింది. ఫార్మ్ డి తీసుకున్నాను సార్.
Very good. Very good. Good decision.
Good afternoon, sir. Myself, Hasni. Good afternoon, sir. Myself, Hasni. So I choose this profession.
Can you speak a little loudly because everybody has to hear you.
I chose this profession because I like the subjects in the family. So I thought this would be an opportunity for me to go through science and invent. So in this career, I personally liked about clinical research. So I want to join that.
It's very good here. And we are discussing with the Gandhi Hospital here nearby for training our students in future. And right now our students are going to medical hospital in Gandhi Hospital where our family students will be trained from 2nd year to 6th year. Yes, please.
Good afternoon. I was B Pharmacy, sir. So when I was in my 9th grade, I was always fascinated about pharmacy because 15, 16 years back, my father worked in NATCO, sir. After that, he came out of it. But he taught me a lot, sir, about chemistry, the way it is and everything. And since 9th grade, I always wanted to take science stream. I chose BC, sir, but I was never interested in NEET. I always thought I'll take B Pharmacy, I'll study, I want to do research, PhD, all that, sir. So when I came to this college first time for looking at it and talking to the faculty, I felt really, I was shocked, sir, because I even went to 2-3 colleges, but I didn't see this type of faculty there. And I personally even talked to Srinivas sir, and sir personally asked me, what you want to do after B Pharmacy, what are your plans, how your parents supported it, are your parents okay with it, and the faculty, they showed me every single lab, how the labs are, classrooms, and everything, sir. So I was literally fascinated at that point of time, and so I directly chose this college, and I'm very excited for the next 4 years. And after that, I want to go abroad, sir. And even PhD, I'm very interested in research scientist. I want to be a research scientist in pharmaceutical sciences. Thank you.
Thank you very much for choosing this family, and then you have made your plans to go abroad. We will try to help you out in placing you in wherever you want abroad. And but you have 6 years to go through this journey, or 4 years of B Pharmacy. Then when you reach the 3rd year towards the end, our people will guide you to write the exams required for going abroad and choosing the right university for doing MS in pharmaceuticals. So we will help you out for going abroad also, because there are many of our students who are working in US, in UK, in Germany, in Australia and many other places. And we have a lot of contacts over there, and our friends from US, they keep coming to this institution. Now for example, on 14th of this month, Dr. Sambaradi is coming from AMU Medical University in Houston. He is going to deliver a lecture, address our students, our faculty members. He is the inventor of 2 medicines in cancer therapy. So he's a great scientist, and he is keen to come and address our students. So regularly from US, our friends who are working in the industry, in the academia, they come, and also we have MOUs with the universities abroad, where we can have an exchange program that our students can go there, our teachers can go there, and they also come here and get trained. Like that, we are signing various MOUs with the universities abroad. So all these facilities will help you in shaping your future. So any other students, please.
If anyone want to come out to the stage, come.
These premises, so keep asking questions. And now, why you have chosen pharmacy profession, and why you have chosen our institution? Anybody can, either parents or the.
మా అమ్మాయిని బీఫామ్లో జాయిన్ చేశాను. మా అమ్మాయిని ఇందులో జాయిన్ చేసుకోవడానికి మెయిన్ రీజన్ ఏంటంటే, భవిష్యత్తు మొత్తం బయోవర్క్ జరగబోతుంది. మన పిల్లల్ని ఫామ్ వైపు తిప్పితే భవిష్యత్తులో మనం చాలా అంటే చాలా, ఎలా అంటే 1,00,000 గన్నులున్న ఒక బీఫార్మా స్టూడెంట్ ఉంటే, ఫార్మా స్టూడెంట్ ఉంటే మన ఇండియాలో 50% సేవ్ చేయొచ్చు. సెకండ్ థింగ్ ఏంటంటే చైనాలో పుట్టిన కోవిడ్ ఇప్పటికీ చైనా వాళ్ళు బాధపడుతున్నారు. ఇండియా 80% రిలాక్సేషన్లో ఉంది. ఆల్ కంట్రీస్లో 70% ఇంకా సఫర్ అవుతున్నారు. ఫార్మా అనేది జనరల్గా ఎవరికి అంత ఐడియా లేదు. రియల్గా నేను ఈ వేదిక పైన వచ్చి మాట్లాడడానికి మెయిన్ కారణం ఎవరంటే గౌరవమైన శ్రీనివాస్ గారు. ఆయన ఇవ్వడము నిజంగా అసలు ఫార్మా అనేది నాకు జీరో నాలెడ్జ్, నాకు నాలెడ్జే లేదండి. అసలు ఆయన గారి దగ్గరికి వచ్చి ఒక 2 నిమిషాలు కూర్చున్నాను. అసలు ఏంది వ్యవస్థలో మెడికల్ రాసిన తర్వాత నీట్ రాసిన తర్వాత ఫర్దర్ ఎలా ఉంటుంది, పిల్లలు ఎటువైపు వెళ్తారు. బైపీసీ స్టూడెంట్స్కి ఉన్నాయి 2 దారులు. ఎంపీసీ స్టూడెంట్స్కి చౌరస్తాలో ఉంటే 4 వైపు వెళ్ళినట్టు ఉంటాడు. కానీ మా పిల్లలకి ఎందుకు ఎలా అవుతుంది ఏంటి అనేది నేను చూస్ చేసుకున్న తప్ప ఏంటి ఏం జరిగిందా అసలు భవిష్యత్తు మా పిల్లల్ని అంత ఇబ్బంది పెట్టాను అన్నట్టే శ్రీనివాస్ గారు 2 విషయాలు చెప్పారు. నిజంగా ఈరోజు ఈ వేదిక మీద మీ అందరి ముందు మాట్లాడడానికి నిజంగా నా వెన్నంటూ ఉన్న శ్రీనివాస్ గారికి మరోసారి థ్యాంక్స్ చెప్తున్నాను. మా అమ్మ ఏమందంటే నాన్న ఫామ్ డీ చేస్తాను 6 years, నేను ఇన్ఫామ్ అమెరికాలో చేస్తాను, నువ్వు చేయడానికి మీ నాన్నగారు రెడీగా ఉన్నారు, నువ్వు చేయడానికి ఓకే అమ్మా, ఫస్ట్ నీలో స్కిల్ ఉండాలి, ఆ స్కిల్ 4 years చూడు, ఆటోమేటిక్ నీకు ఇంకో 4 years ఉంటుంది, నువ్వేంటో నువ్వు ప్రూవ్ చేసుకోవచ్చు అని అన్నారు. మా అమ్మాయి కాస్త వెనక్కి ముందు ఆలోచించింది. అవును 6 years ఎందుకు, ఈ 4 years నా టాలెంట్ ఎందుకు చూపిస్తే తర్వాత 2 years అది చూపించిన తర్వాత ఫర్దర్ ఫ్యూచర్ అంతా నాకు బ్రైట్ ఉంటుంది కదా అన్నట్టు ఆలోచించింది. పిల్లలకి కొన్ని విషయాలు తెలియదండి. పేరెంట్స్ మనం ఉన్న ఈ సొసైటీలో మనం ఫైట్ చేసేసరికి సగం అయిపోతుంది సార్, సారీ టు. కానీ ఈ అప్పాజీ గారు కూడా కొన్ని విషయాలు చెప్పారండి. మన ప్రపంచవ్యాప్తంగా 120-130 కంట్రీలకి మనం ఇచ్చే ఔషధాలు ఎలా ఉన్నాయంటే వాళ్ళు మనం ఎప్పుడు పంపిస్తామని ఎదురు చూస్తున్నారు. ఇక్కడ పిల్లలు ఇక్కడ ఉన్న మెడిసిన్ మ్యానుఫ్యాక్చరింగ్ అయిన తర్వాత కంట్రీస్ కొన్ని వెయిట్ చేస్తున్నాయి. నాట్ ఓన్లీ బిగ్ కంట్రీస్, ఆల్సో స్మాల్ కంట్రీస్ అందరికీ మనమే దిక్కయ్యాం. ఆ దిక్కులో సరోజినీ నాయుడు వనితా ఫార్మసీ కాలేజ్లో మన పిల్లల్ని ఒక సరస్వతి కుసుమం లాగా ఈ వనంలో నాటాలన్న ఆలోచనతో నా కూతురుని ఇక్కడ వేశాను సార్. మళ్ళీ చెప్తున్నందుకు అందరు నన్ను క్షమించాలి. శ్రీనివాస్ గారే నాకు మెయిన్, ఆయన గారే నాకు అసలు రియల్ చెప్తున్నాను. నాకు అసలు ఈ మెడికల్ ఈ ఫార్మా ఇదంతా తెలీదు. మా అమ్మాయిని లాంగ్ టర్మ్ చేయించాను, 2-3 మార్క్స్లోనే పోయింది. సరే దిగులు చెందక నాన్న ఒక్కసారి వెళ్ళొద్దామన్నాను. సరే ఇంకోటి కూడా ఇంతమంది సమక్షంలో మరో విషయం కూడా నేను బట్టబయలు చేయాలి. ఈ ఫార్మాని అడ్డం పెట్టుకుని కార్పొరేట్ కాలేజీలు ఎలా దోచేస్తున్నాయంటే ఇంటికి కూడా వెళ్ళట్లేదు, దారిలోనే దోచేస్తున్నాయి. ఈరోజు ఈ ట్రస్ట్ నాకు ఆక్సిజన్ ఇచ్చింది సార్. వెంటిలేటర్ పైన ఉన్నవాడికి ఆక్సిజన్ అవసరం లేదు, ఆ వెంటిలేటర్ కూడా తీసేసి నార్మల్గా న్యాచురల్గా బతకొచ్చు అనేది ఈ వేదిక నాకు కలగజేసింది. కేవలం 75,000 కడితే ఓ ఇయర్ అయిపోతుంది, 4 ఏళ్లలో 3 lakhsలో క్లోజ్ అయిపోతుంది. అదే ప్రైవేట్ కార్పొరేట్ 10+ lakhs. ఎంత దారుణం అంటే మనం చేయలేము, పిల్లల్ని చదివించలేము, అంత ఘోరమైన ఇక్కడ అంత దరిద్రంగా ఉంది. ఎనీహౌ సార్ నాకు చిన్న అవకాశం ఇచ్చినందుకు నా హార్ట్ఫుల్గా నాకు చెప్పాలనుకున్నాను, చెప్పాను. నాకు చాలా హ్యాపీగా ఉంది ఏంటంటే నా కూతుర్ని ఈ కాలేజ్లో జాయిన్ చేసినందుకు రియల్లీ నేను చాలా హ్యాపీగా ఫీల్ అవుతున్నాను సార్. మరోసారి శ్రీనివాస్ గారికి నేను జీవితాంతం రుణపడి ఉంటాను. రియల్ సార్.
Anybody else?
Good afternoon, sir. Myself Kiran Naik. Placements, education and facilities, some extracurricular activities. I like this. I like to claim. I gone through the hospital because I'm suffering from some issue. I check up this. There is no medicine for some diseases. They are suffering a lot. And but many I feel saw many small children also. They are age is small, but the disease is not curing. I interested in medicine to cure what medicine is effective and it cures the every child who are suffering. And want to research about everything and want to find out what is the cure for that any medicine. So I want to choose the place.
స్టూడెంట్స్కి ఒక మెంటర్ ఫ్యాకల్టీని అలాట్ చేస్తాం. వాళ్ళ కోర్స్ స్టార్ట్ అయినప్పటి నుంచి ఎండ్ అయ్యేదాకా ఆ ఫ్యాకల్టీ విల్ బి గోయింగ్ త్రూ నాట్ ఓన్లీ అకాడమిక్ ఇష్యూస్ బట్ ఎక్స్ట్రా కరిక్యులర్, కో కరిక్యులర్, పర్సనల్ ఇష్యూస్, ది ప్రాబ్లమ్స్ దట్ దే ఆర్ ఫేసింగ్ అన్ని పేరెంట్స్కి కాలేజ్కి ఒక నెట్వర్క్గా ఉంటారు. సో మెంటర్ ఫ్యాకల్టీ డీటెయిల్స్ ఆల్సో విల్ బి గివింగ్ యూ ఆల్. సో ఇట్ ఈస్ నాట్ జస్ట్ వన్ పర్సన్ బట్ ప్రతి ఒక్క 15 మందికి ఒక ఫ్యాకల్టీ విల్ బి అండ్ దట్ విల్ బి టేకెన్ కేర్ అగైన్ రివ్యూ పీరియాడిక్గా రివ్యూ చేస్తాం మేము. సో డోంట్ panic, rest be assured that it is not only the day one but throughout the 4 years or 6 years of the course we will be attending the needs and wants of the students. Okay,
to she can be better in the pharmacy and she can give her best in the pharmacy. So the kind of facilities this institution has given and the interest, and I just appreciate the institution and the management and faculty also here, because the way I came here for the admission, I was in the village, Bachpalli. I started there at 4 o'clock and I requested that I wanted to take an admission here. I reached here around 6:30 in the evening. Till the 6:30 they gave me a time. They waited for me for a longer time and they have taken an admission. They have allotted a last seat to me. I mean the one which was ready. So I'm very much thankful for giving such an time and importance to my daughter. And before there's orientation, I was just under an impression that B Pharmacy is meant only for the placements or the jobs. But now after the various knowledge I have got it from the Sir Apadi sir and the Prabhashankar sir, I have got more knowledge, and now I am interested to push my daughter into the research institute or into the entrepreneur. So hopefully she will get the best from this institute. Thank you so much.
Parent-teacher meeting like in schools. But here we give an opportunity to all the parents to walk in to our college in the afternoon session, meet the principal or the director and inquire about their child, their performance and all. They can meet the teachers also to interact with them and know about their child's performance. So that opportunity is given to all the parents. So they are always welcome to visit our institution whenever they want and inquire about their child.
For sharing your opinions and asking your questions.
Now I would like to call upon a chairman, Dr. B. Prabhashankar Garu, President IP Telangana State Branch, to felicitate our chief guest.
actually सामान ऊपर जैसे यहाँ से लेता हूँ सर actually ये होना कश्ती होना वो राइट मशीन Okay, wait. 10.
Thank you, sir. I now request our Vice Principal, Dr. T. Mamta Ma'am, to propose vote of thanks.
As well as parents, those who joined into the first year of B Pharmacy as well as PharmD course today. So I'm very much thankful to our chief guest today, P.V. Apadi sir. He is just now, as he said, Bhishma Pitamaha of Indian pharmaceutical industry. So he came here to our college, that's means with so much of knowledge as well as experience in pharmaceutical industry. So just now in the morning we discussed that he has seen the industry in one room with a tablet punching machine, and now he can see the industries with modern technologies, means where the artificial intelligence is going to be utilized. So that way, that his knowledge he shared about all the drugs, APIs, as well as means how the herbal drugs are going to be standardized, and we can make use of those drugs without any problem. And also he shared about, means whatever he shared, the parents also are very keen to listen to them. That's what we understand by the questions, by the the points that they are sharing. Thank you, sir. Thank you for your valuable time. And the college is inviting with so much knowledge of pharmacy industries. We are very thankful to you, sir. And we are very much thankful to our chairman, sir, who selected the chief guest of today's function. And we should be thankful, means all the members of faculty, non-teaching, as well as those who joined today. Because our chairman, sir, is from pharma industry, pharma profession in all aspects, so that he can understand what we need exactly about the college, means related to the facilities, infrastructure, and what the students can do in the future also. He can understand better. That's what he only asked to, means said that we can ask questions to the students as well as parents, so that we can get what they understand, what they want to do, so that we can plan in that way, means collaborating with industries as well as universities of foreign countries also is in process. One university we had collaborated with Pacific University of USA. So those who are planning for going to the abroad can do the means part of the project, or after B.Pharm they can go to that university without any problem. Means we are here to guide you. Director sir, principal madam, as well as senior faculty are here. And I say thanks to the members of governing body for their gracious presence in this orientation program. Thank you, sir. And thank you to my colleagues as well as Principal Madam Sarita Madam, who could not be present today. And thanks to Director Sir. So every parent, every student knows our Director Sir, who is involved in admissions, not only giving the admission, he says the importance of pharmacy profession. That's what we understood just now. Means whether they take the admission or not, he'll convey what the profession is, what is its importance. Means those who don't know about that, just now parent came and spoke, he don't know about the pharmacy, but he could improve the knowledge about the pharmacy, and he could join his daughter in our institute because of the motivation by our director sir. So like that, all the faculty, means those who have shown the labs also, they have shown each and every lab what are the infrastructure we have. So that's what the parents as well as students got to know about the college infrastructure. So thanks to everyone, those who involved in that. And thanks to the supporting staff who are giving their support in arranging all this on the dais, off the dais. And thanks to the Sudha Madam and team who decorated the lamp beautifully. And thanks to the parents as well as students, parents for their time, and because we selected Sunday, though we faculty as well as all the employees don't show interest to come on Sunday, but we took the Sunday as working day for the parents' presence in today's orientation program. And I say thanks to one and all, those who involved directly as well as indirectly. Thank you very much.
Thank you, ma'am. After lunch also we have a program where experiences and students and faculty thoughts will be seen. I now request the audience to raise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि भाति तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जय हिंद.
Yeah, I request the students, newly joined students and faculty, parents, within 30 to 40 minutes we will arrange the lunch for all the all over gathered here. Till that you can make lab rounds and you can see the classrooms, labs over in the campus. Thank you.
PharmD as well as 3 branches of pharmacy, that is pharmaceutics, pharma analysis as well as quality assurance. So I will be going little bit fast. After that, the students are waiting to introduce you about the club activities as well as they want to share their experiences in this college. So we welcome you once again in this college, and this is a choice-based credit system that everybody know. And coming to the academic rules and regulations of B Pharmacy, it is divided into 8 semesters, and total working days, if you see in the semester, it is not less than 100 days. In theory as well as practical separately. And the minimum credit requirements in total is 208, that is 208 credits of both theory courses, tutorials, practicals as well as practice school and project work, which is there in the 7th semester and 8th semester of B Pharmacy. And also the credits are there for co-curricular and extracurricular, but these are not mandatory, means for those co-curricular and extracurricular, I will show you what are they, means presenting a paper in the conferences or attending a workshop or attending an internship program. So all these also carry credits. So this is in general, you can see the code of conduct in lectures or in classrooms. The attendance is must, and attention, that is listen and don't talk to others during the lecture, and manage yourself and be respectful to your classmates as well as to the faculty. And also the lab assistants, lab technicians and others. Next A is active note taking, means whatever is the lecture is going on, try to note down so that you can maximize the learning process. And just now in the morning also sir said clearly that if any doubt is there, try to ask on the spot. So mobile phone better to switch off in the class. And this is last one, that is authority issues. And I'll take the example of semester 1 and explain you, means how many number of theory classes that is divided into, means the number of classes, regular classes as well as tutorial classes. So in first semester you can see the number of courses, that is theory as well as T indicates theory, P indicates practical, and number of theory classes 3 plus 1, 1 indicates tutorial, that you can see here 3 plus 1, that is 4 classes which carries 4 credit points. So generally in the tutorial class we will take the revision of the topic that is completed in 3 classes, and that can be done in the form of a slip test or quiz or group discussion or role play. Like that it can be done in the tutorial class. And 4 classes for theory most of the times, and some of the subjects it may be 2 classes or 3 classes, means 2 plus 1. And coming to this practical, you can see the number of hours per practical is 4 and carries 2 credit points. So like this every semester is divided, having few subjects carrying few theory classes and tutorial classes carrying credit points, both theory as well as practical classes. And what is this star mark indicates is non-university examinations related subjects. Means in B Pharmacy first, if you see, it is divided into 2, that is continuous mode and theoretical exam. 10 plus 15 marks, and which is a total of 25 marks, and the duration is 1 hour. So what is continuous mode, I will tell you in the next slide, it is there. So this is internal, 10 plus 15, that is for theory, and when you come to the practical it is 5 plus 10. 5 plus 10, 10 is for written, means practical exam, and 5 is for continuous mode. Continuous mode means attendance, regular performance and regular submission of the records, all these carries the 5 marks, that is continuous mode of examination. So this is about internal assessment, and coming to the final theory, 25 plus 75, and the duration of exam is 3 hours. 25 is 10 plus 15, 25. And in the practical it is 15 plus 35. End exam is for 35 marks. So total of 50 marks. And for this non-university examination the duration is 2 hours, which carries total of 25 marks. So like this each and every semester it will be in each and every semester. It goes till 8th semester. 8th semester means 6th, 7th and 8th we are having practice school and project work. So you can see here how the evaluation of the marks in a continuous mode is done. So in the case of theory, it is total of 10 marks. It is divided into 4 marks for attendance and 3 marks for academic activities and 3 marks for student-teacher interaction. So student-teacher interaction, as sir said, mentors will be there, as well as those who are teaching that particular subject also will interact with each and every student. Based on that also, the marks will be given. And coming to this practical, means when the marks are 5, it is 2 plus 1.5 plus 1.5. This is about theory continuous mode evaluation. And coming to the practical, attendance carries 2 marks and practical record, regular YOC will be there, carries 3 marks and in total 5 marks. Means not only writing the exam, both theory as practical, but your regular attendance, regular performance and regular interaction, regular YOC, all these carry marks in continuous mode. Yeah, here the marks are given like, for example, if you see 4 marks for attendance. So how do you get 4 marks? Or if it is 3 means what? So 95% to 100% means 4 marks for that particular percentage of attendance. If it is less than that, 90 to 94, 3 marks. So this is for theory and this is for practical. Less than 80, 0. Coming to the sessional exams in B Pharmacy, each semester 2 sessional exams shall be conducted for both theory as well as practical courses, and average of 2 will be considered and calculated in the final one. Means in a total of, for example, total I have shown 25 marks. So it's the average of 2 sessional exams marks. Sessional and internal both are similar. So generally, sessional exam shall be conducted for 30 marks, that is for theory, and it is calculated for 15 marks. Conducted for 30 marks but calculated for, that means if you see the question paper, questions will be given for 30 marks, but it's going to be divided by 2, so it is calculated for 15 marks. Similarly, for sessional exam of practical, it is conducted for 40 marks and divided by 4, so 10 marks is taken into consideration. Is it clear? Means the question paper carries 30 marks of questions, but it's going to be divided by 2 and it is calculated for 15 marks. In a similar way, 40 by 4, that is in practical. And the question paper pattern, there are 3 different sections. First section, it may carry multiple choice questions or objective type of questions. Multiple choice means each carry 1 mark. Objective type, 2 marks each question, that is 5 into 2, 10 marks. Means first section 10 marks. Second one, long answers, that is 1 out of 2, that is 10 marks. And the third is 2 out of 3. So you can see here in the first section there is no choice. Second and third choice is there. And total of 30 marks. This is for sessional exam, means theory sessional. So it is again divided by 2, 15, and the 10 will be the continuous mode. This is for having non-university examinations like your communication skills, those subjects. It is divided into long answers and short answers, means 1 into 10 and 4 into 5, that is 30 marks. And for practical sessionals, already they gave the division of the marks, that is first one is synopsis, second one is experiments, and third one is YOC 10 plus 25 plus 5, 40. This is internal practical exam. So 40 by 4 again, 10 marks. 10 marks plus continuous mode 5, that is 15. And end exam is 35. 15 plus 35, 50. Then how the grading will be? Minimum pass percentage is 50. Below 50, fail. And total is 100. So out of 100, if you get 50, that is pass mark. That is pass mark including internal assessment. Internal plus external, including that, it's a total of 20. In that, you should get 50. Minimum 50, which is a pass mark. There is an option for improvement only in the case of, means if any genuine cases are there, that will be considered to reconduct the recessional exam before completion or before going for the end semester theory exam. That is very rare case. This is final question paper pattern for 75 marks. There also similar pattern will be there, whatever is there in the sectional exam. That is divided into 3 sections, multiple choice, long answers, short answers, so total of 75. I will be little bit fast. And this is for 50 marks. And for practical examinations also you can see similar way like sessional, only the marks is different, that is 35 marks. And this is the grading that you get in the mark sheet or memo finally. So generally it is given in terms of the letters, and letters indicate, you can see here O indicates outstanding, like that excellent, good, fair, and the percentage of marks also you can see if it is above 90 it is outstanding. So less than 50 is F, and absent it's going to be indicated by AD. So all the semesters together it is going to be calculated the aggregate, and first class with distinction will be given if the CGPA is or above 7.5. In a similar way, CGPA of 6 to 7.49 under first class. So in a similar way, second class also you can see, and below that it is fail. Means university ranks, or if any college gives any medals or awards or ranks, it's going to be based on the total CGPA that you are going to get. And here the clause is the candidates who fail in one or more courses during B Pharm, means any semester, if anybody fails in one of the subject also, those are not eligible for the ranks or awards. So the candidates who fulfill the requirements of all the above, means 8 semesters, if you pass, then within 4 years during the convocation you are going to get the degree. And coming to the founding, it's a year-wise course of 6 years, and the working days, if you see, it's not less than 200. In B Pharm you have seen not less than 100. It is divided into 2 phases. First phase is 1st to 5th year, and second phase is 6th year, where the students go for internship or residency in the hospital. Most of the time, or 100% time, they are going to be in the hospital only. But second year to 5th year also they will go to hospital for 1 or 2 days in a week for their clinical pharmacy or pharmacy practice work. This is one example of PharmD, first year. And you can see the subjects, number of hours theory as well as number of hours practical. In B Pharm it is 4 hours per practical, this is 3 hours here. And number of 3 is also 2 or theory, 2 or 3. And the credit number of tutorials is also 1. Similarly we will follow, the tutorial classes will be engaged in the form of quiz, slave test, group discussions, like that. Examination schedules little bit different because that is a semester wise course, this is year wise course. Sessional exam carries 30 marks, final exam 70, right? Yeah, total of 100. So 3 times the sessional exam will be, and best 2 will be considered, average of best 2 will be taken into consideration for calculating this 30 marks of sessional. And final exam carries 70, so total of 100, and here also similarly the pass mark is 50, minimum 50. So 80% attendance, that is minimum, both theory and practical separately, and the final means in both 5th year as well as 6th year will be having clerkship examination and internship of 1 phase. In the 6th year it will be. This is what I said just now, means 3 sessionals will be there, 2 best will be considered for calculating the average. In a similar way for the practical examination also. Here also the practical exam, if you see 20 plus 10, both the practical exam 20 plus 10, and 10 marks is based on the attendance, YOC, record and regular performance. So 50% is the pass mark. And we should be careful in Foundry especially, means throughout 6 years, if any student fail in any one exam, in any course, in any year, so they are not giving, means particular universities are not giving, if they secure more than 60% also, first class, they are giving like pass. So we should be careful such that we are going to write the final exam and passing the exam in that first attempt itself. So more than 60 is considered first class and more than 75% is considered as distinction. That's what is given clearly with subjects in a single attempt. Subjects in a single attempt. This is most carefully we have to listen to this. That is, if a student fail in theory or practical exam of particular subject, she has to write both. She failed in practical exam means she has to write the theory also. So that is there only in Form D, not in B Form. And the promotion rules, first year, all students who have appeared for all the subjects and passed the first year annual examinations are eligible for promotion to the second year and so on. However, failure in more than 2 subjects shall debar, means they cannot be promoted. So 2 subjects are allowed, not more than 2 subjects. Is it clear? If there are 6 subjects or 5 subjects in a year, minimum 3 subjects we need to pass and 2 subjects can be failed. If more than 2 subjects fail means not promoted to the next year. Yeah, this is about internship. Anyway, Venu sir, Foundry HOD, will explain about this when the Foundry HOD is introduced. This is. Coming to the committees. This is the main committee which we want to tell that till now there is no case related to the ragging. Anyway, the committee is there, which includes the principal madam. She is the chairman of this committee, and as well as director sir is there, and senior faculty and student members are also there. You can see Madhasini as well as Diksha. So if any problem is there, they can contact any of the member or chairman directly, personally or through a letter. So in a similar way, another committee is there, that is grievance redressal committee. So means whatever the problem is there, the student can contact any of the committee member either personally or through a letter, and it can be solved without any fear, without problem. The another one is, this also we have the placement committee. Placement coordinator is Dr. Venu sir. Again he will explain a little bit about the placements. Every year, means you might have seen in the college profile also, the prospectus that is given to you, what are the companies visited recently to our college and recruited the students of both BPharm as well as MPharm, BPharm as well as Foundry. Only the academic part, we will take care of both the co-curricular as well as extracurricular activities also. So there will be conferences, 1 day or 2 day conferences, and workshops as well as the guest lectures on advanced topics, it will be there. And as well as the visits to the industries where the students can come across all the means large scale equipment during means in the different departments of the industry. As well as you can see here the extracurricular activities also will take care, that is we have gone to Wonderla as well as visit to exhibition like that. Next page. Yeah, these are the placement details. What are the companies that visited last year recently? You can see that means there are some companies visited to the college, and there were placements off campus also where the students went to the industries and selected. So the placement companies, it includes both multinational companies, hospitals, software companies, or diagnosis laboratories. It includes all the types of companies where they recruited both BPharm as well as Foundry graduates. Okay, I'll stop here. This will be taken care by the students. Thank you one and all. And if any doubt is there, you can ask here, or later on also you can ask, means the student can ask the class teacher. Class in charge will be there, as well as mentors will be there. They will guide you. Thank you one and all.
Thank you, ma'am, for enlightening us with the rules and regulations of academics. Pranita, did you understand the whole purpose of this academic rules and regulations?
Yes, Lisa, I understood that as discipline is the bridge between goals and accomplishments, I wish you to follow all the rules and regulations and accomplish your goals. Lisa, can you say me that why your college stands in a top pharmacy colleges in Telangana?
Definitely, I'll tell you the reason. It's because our college delivers the quality education, and this is only possible by the teamwork of faculty and management. Mainly the heads of all the departments who directs the staff and students with their guidance towards the path of quality successful life.
So, are you guys interested to know about various specialization departments in our college?
But before that, let us know a little bit more about our director, principal and vice principal of our college. Dr. N. Srinivas, Director and Professor of Sarojini Naidu Vanita Pharmacy Mahavidyalaya, has completed B Pharmacy from Kakatiya University, Warangal in November 1991. He has pursued M Pharmacy in Pharmaceutics from Birla Institute of Technology, Mesra in March 1997. Sir was awarded PhD in 2009 from JNTUH, Hyderabad. Sir has 56 research publications, 2 patents, 1 funded projects to his credit. Sir has experience of 3 years in industry and 26 years in teaching.
Dr. T. Sarita Joshna, Principal and Professor of Sarojini Naidu Vanita Pharmacy Mahavidyalaya. Ma'am graduated her B.Pharm from Kakatiya University, Warangal in 1994 and M.Pharmacy in Pharmaceutics Chemistry from Birla Institute of Technology, Mesra in 1997. And Ma'am was awarded her PhD from Kakatiya University in 2010. Ma'am has 31 research publications to her credit.
Dr. T. Mamata, Vice Principal and Professor of Sarojini Naidu Vanita Pharmacy Mahavidyalaya. Ma'am has completed B Pharmacy from Kakatiya University, Warangal in 1997. Ma'am has pursued M Pharmacy specialization pharmaceutics. Ma'am was awarded PhD in Pharmaceutical Sciences from JNTUH, Hyderabad in 2011. Ma'am has 43 research publications, 2 patents and 1 chapter in a book to her credit.
Now, let's begin with introduction of HODs of each department, starting with Dr. B. Harika, HOD of Pharmaceutics. Ma'am done her B Pharmacy from HKES College of Pharmacy, Gulbarga.
We heartily welcome all of your students into this Vanita family. I am Dr. Krishnaveni. So I have 12 years of experience. I will be teaching organic chemistry to family first years and reform. Thank you.
Good afternoon everyone. I am Indira here and I am glad to say that I have completed my B.Pharm from the same institute and M.Pharm from Polarity College of Pharmacy, and I am working since 2014 here and I have 16 years of experience. So welcome you all for the SNVP family.
Good afternoon one and all. I am Shilpa of Pharmaceutical Analysis and Quality Assurance Department. I completed my B.Pharm in Bojam Narsingu College of Pharmacy, whereas M.Pharm in Sri Venkateshwara College of Pharmacy, and I am having 5 years experience.
Department of Pharmaceutics to the students.
I am the HOD of Quality Assurance. So this branch earlier it was not there, means if you see 15-20 years back it was not there. We see the pharmaceutics, pharma analysis, pharmacology and pharmacognosy, pharmacochemistry. So this is a newly introduced branch, newly means 15-20 years back, and this year we introduced, last year we introduced this branch in pharmacy specialization. And if you see what are the subjects that are there in this quality assurance branch, each and every topic, whatever is going on in the industry, it is going to be there in the subject. So the syllabus is well framed and it's most suitable for the pharmaceutical industries. So that's what we are, one subject is there in third year also, 3-2, means third year second sem. And they'll come across all the basics in the quality assurance subject, as well as in industrial pharmacy, a subject also 1 or 2 topics related to quality assurance available. And when you come to the MPharm, the different subjects, means it may be related to quality control, or it may be related to product development and technology transfer, or it is quality management systems. Each and every subject, they'll go through what is happening in the industry, what are the regulatory guidelines that are there to market the drug into the different countries. So I'll invite my department faculty to introduce themselves one by one. Thank you.
Good afternoon. Myself, Dr. Anuradha Bai. My specialization is pharmaceutical chemistry. I'm the professor quality assurance department. So I teach chemistry subjects to B pharmacy, pharmacy and pharmacy students. I teach all chemistry subjects, medicinal chemistry, organic chemistry, inorganic chemistry, and all subjects. So I have 22 years of teaching experience. In this institution itself, I have 17.5 years of experience. And I am the class teacher for PharmD first year students since its inception. Okay, my research area is on rational drug design and synthesis of heterocyclic compounds, and we are doing research on phytoalexins. Okay, I welcome B Pharmacy and PharmD students to the Vanita family. Thank you.
Good afternoon, one and all. Myself, Prashanti. I have done my B Pharm and M Pharm from Usmania University. Now I am doing my PhD. I am working here from last 7 years. I have before that 4 years of industrial experience. I worked in Aurobindo Pharmaceuticals in quality control and quality assurance department. A very hearty welcome to all freshers. Thank you.
Very good afternoon to one and all. Myself, Dr. Shivajyoti. I have 8 years of teaching experience, and I completed my B Pharmacy from Rapatla College of Pharmacy and M Pharmacy from G. Pulla Reddy College of Pharmacy, and awarded PhD from JNTUH, Hyderabad in the year 2021. And all the freshers, I heartily welcome you, that is both B Pharm as well as the PharmD students, to the SNV family. Thank you.
Completed diploma in pharmacy from Kamala Nehru Polytechnic for.
So good afternoon one and all. We are welcoming all the PharmD students and B Pharmacy students for SNVP family. So for chemistry department we have 5 members totally. Even our principal belongs to pharmaceutical chemistry department. So madam is on leave and other 2 staff are also leave. Sirisha madam is also on leave, Meenakshi also leave. So now we 2 are there. Okay, na? So we will teach all the chemistry subjects belongs to PharmD as well as B Pharmacy, and many other faculties are also teaching chemistry subjects because they are originally their chemistry department. Due to the deficiency of staff, they are shifted to other departments. The chemistry can teach analysis as well as quality assurance also because we are interrelated subjects. So all the students, whatever problems we have in chemistry department wise, that is pharmaceutical chemistry subject, we are there to solve all the problems. So you don't fear of the subject because we are there to take care of individual subject in chemistry. Thank you one and all. So she is Kavita, moreover she is our M.Pharm student, joined as a lecturer here.
Good afternoon one and all. I am Kavita Baburao, specialized in pharmaceutical chemistry. I have 6 years of experience. Presently I am pursuing my PhD at Geetham University. 2 years are completed. I welcome you all to SNV PNV family. Thank you.
One more information, I have joined in this institution in 1999 as a bachelor. So now nearly 24 years experience in this institution.
Sarojini Naidu Vanita Pharmacy Mahavidyalaya. Probably B Pharmacy would be the 24th batch we would be welcoming into the portals, and PharmD will be the 6th batch we'll be taking in. I joined this institution the millennium year, that is 2000. So I've got 22 years of experience and 5 years of industrial experience. I invite my colleagues and faculty first. Please come.
Good afternoon all, I am Dr. Tanita. I have completed my B.Pharm, M.Pharm and PhD from Kakti University, and I have 5 years of teaching experience and 6 years of research experience. I have 16 research publications to my credit, and I welcome you all to the family of SNVP. Thank you.
I am Limol Verghese. I joined this institution in the year 2007. I completed my M.Pharm PG, that is from JSS College of Pharmacy Ooty. I am pursuing PhD, and in the last year I am going to submit. I am teaching all pharmacognosy related subjects, even engineering, B.Pharm and PharmD. Thank you.
Andarki namaskaram. I feel very proud to introduce myself as a first batch student of this college. First batch student of this college. I have completed my PG in Pullareddy College of Pharmacy. I have total of 18 years experience. In this college, 11 years of experience. I welcome you all to our college, that is our family. Feel free to talk to anyone in the, you can come to any faculty regarding if you have any personal thing or related to subject, anything, feel free to come to us. Okay, I wish you all the best. Welcome you all.
Hello, good afternoon all of you. I welcome both B.Pharm and PharmD to SNVP MV family, and I welcome myself also because I have recently joined, and myself Miss P. Srivarsha, graduated from CMR College of Pharmacy, and I have completed my Masters from JNTUH, Hyderabad campus itself, and I have done my project in IICT Tarnaka, and I worked in Malareddy Group of Institutions for about 5 years, 10 months, and recently I have come to SNVP MB, so I welcome you all and I welcome myself also here. So all the best to all of you.
Hyderabad. 25 research publications and 1 patent comes under sir's credit.
And I congratulate first of all to all the students who got admission in this college. Myself, as Lisa mentioned, I am Dr. Renu, Professor of Pharmacology and PharmD, HOD of PharmD. Actually, pharmacology is a very core subject in both B.Pharm and PharmD. Because without understanding the drugs action, nobody can do anything in pharmacy. So that is why every student should remember that you should focus more on this subject. And it is very nice and very interesting subject. Okay, it starts from second year pharmacology, but pathophysiology, anatomy, physiology also we deal. That starts from first year. And for PharmD, this is the life. Pharmacology is the life. You have to understand the molecular level mechanisms of drug action, then only you will excel in your profession. Okay, so I have a total 16 years of teaching and research experience. In this 11 years, I worked in a central government organization. And my core research area is cancer and pulmonary fibrosis. Almost I have guided more than 50 master theses in last 16 years of my experience. And I also qualified in foreign pharmacy graduate equivalency exam, that is to work as a pharmacist in United States. This exam you have to write after going there only. And PharmD students should aim to qualify this exam and should become a pharmacist in abroad, to become a pharmacist in abroad. Okay, so now I will introduce my crew. I request the PharmD faculty also and pharmacology faculty to come here. They compared our animal house facility with a very national level institutes, and every student who joined in B.Pharmacy and PharmD courses will be given animal handling training, and we deal with, at present we deal with rats, mice, guinea pigs and rabbits, and how to handle, how to administer the drug, how to withdraw the blood, and how to give treatment interventions. This all will be do. And just I want to make another mention about this department is that, so with our help only all other departments are existing.
Thank you, sir.
Yeah, chemistry people, when they synthesize a molecule, to see the efficacy, they have to approach pharmacologists. And pharmaceutics people, the very beginning department, if they formulate anything, any drug or any injection or any ointment, to see the efficacy, they have to come to us. And the pharmaceutical analysis people also, they want to define the pharmacokinetics, means what is the concentration of drug, what are the, when one dose is given, how much concentration it is appearing. To know that, they have to administer the drug to animals, and they have to come to us. And there is no doubt quality assurance also should come to us. So this is a core department in pharmaceutical sciences. If anybody denies also, you please don't trust them.
Departments, whatever they do, chemistry synthesize, then formulation, they will develop the formulation, they will see the efficacy, safety, toxicity studies, everything. Who will give the approval? Who will give the approval? When it goes to patient?
And as I said, it will be very interesting. Anatomy or physiology or pharmacology or therapeutics. See, once the PharmD students complete their course, they say, suppose what is your interested subject, means they say therapeutics. Therapeutics also, the basic fundamental subject is pharmacology. And unless they understand pharmacology, I want to make a mention to all the parents also, you insist your child to read more pharmacology, please.
Good afternoon, everybody. By now you must come to know that pharmacology is one of the naughtiest department in this college. Yes, we are. And I have done my B.Pharmacy from Vanita College, 3rd batch student, and M.Pharmacy from Mahila Vishwavidyalayam, PhD from JNTUH, and I have done my master's project at National Institute of Nutrition. That is my research background. And after my B.Pharm, I have done 2 years of industrial junior chemist job, which fetch clinical and ex vivo as well as pharmacoeconomics perspective. And I'll be teaching you one section at least.
To everyone, and I welcome all the PharmD and B.Pharm first year students to the Vanita family. And I'm Shailaja, and I did my B.Pharmacy from Vanita College, and I did my M.Pharm from Malareddy Institute, and now I'm pursuing my PhD in Geetham University, about to submit my PhD. And I'm going to deal with pharmacology subject, as sir told. It's very interesting subject. We will be knowing the drugs, what we are taking for what diseases. For diabetes, for hypertension, for pain, whatever. I tell all the first year students that if you have any problem, not only regarding subjects, if you have any issue, you can come to any and you can share your problems to us. We'll solve your problems.
I did my M.Pharm in the year of 2013. So I have the total experience of 9 years in research and teaching. So I published around
clinical pharmacist. And this change you will see. But I think within 5 years time, you may see in every multi-specialty hospital there will be a clinical pharmacy ward where the PharmD graduates will work. And even the scenario is slowly changing. Most of the PharmD graduates now they are working as a DMOs in big hospitals. Initially they are working as a DMO assistant and then as a physician assistant, followed by once after getting some experience, they are working as a DMOs. And the Sarojini Naidu Vanita Pharmacy Mahavidyalaya is associated with Medicover hospitals located in high-tech city. And as Dr. Mamta Madam mentioned, second year onwards, the students start going to the hospital to collect the cases. And this will be there for 3 years. And 5th year, weekly 3 days, the student will be there in hospital to do the project. And 6th year, back to back, entire year, the students will be there in the hospital. They have to work in 4 wards, 6 months in general ward and 2 months in 3 specialty wards. And we faculty, PharmD, along with them, we are going every day. One faculty will be associated with the students who are visiting hospital. Every day, from Monday to Saturday, every day there will be some year students be there in hospital. And we are providing a bus facility also from the institute for 2nd, 3rd and 4th years. And they have to collect the case and they have to present in front of the faculty. Then we will ask them why the treatment is given, what is the diagnosis, why they did the diagnosis, what is the interpretation. why doctor has given that particular drug, by 3 days. Okay, like that so many questions we ask. That is why the students will go through the case thoroughly and they will discuss with the concerned faculty before presenting in the department. And all of us, all PharmD faculty, today 4 faculty are absent because of some personal reasons. There are 7 faculty are there in PharmD, and we are all involved in both hospital activity and also in academic activity.
So good afternoon one and all. Myself Dr. V. Santoshni, and I have graduated from Mallaridi Institute of Pharmaceutical Sciences, passed out from 2017. From 2017 onwards, I am having teaching experience. As Sir said, being a PharmD student, initially you need to know the anatomy and physiology of a particular body. After that, you need to apply the pathophysiology. Similarly, once you know the anatomy and physiology and where the problem arises, to that you will be applying the pharmacology. So finally, when you apply the pharmacology, you will be reading the therapeutics where the treatment starts. So initially, these are the base subjects for PharmD students where you need to learn. So once you read this human anatomy, physiology, pathophysiology, ecology and therapy, then you can diagnose a disease which is pro-diagnosis or the final diagnosis based on the laboratory investigations. Overall, you will read a complete case profile. After that, you will be into the therapy of the patient. After doing all these things, you will have a position called DMO, Duty Medical Officer. After that, you will have physician assistant. So if you want to work through abroad, you will have bench, desk and all. After that, you will be entering into the pharmacist or the clinical pharmacist cadre. This is about PharmD course. And now, I invite all the students of SNVP. I heartily welcome to the college. Feel free to ask any doubts of your college perspectives and feel free to interact with all the faculty present here. Thank you.
Good afternoon everyone who are present here. Myself Divya, Department of Pharmacy Practice. I have 5 years of teaching experience. Dear students, wish you all the best. Thank you. Have a good day.
Actually, though she is standing beside me, I asked her to introduce later because we are proud to introduce our PharmD first batch student as a faculty here. She is a Hadia.
Good afternoon everyone, and I welcome all the BPharm and BPharm and PharmD students to Vanita family. And I am proud to introduce myself as the PharmD first batch student of SNVP. And I am teaching HAP, that is Human Anatomy and Physiology for PharmD first year. I hope you will enjoy this subject and your college life in this. And good luck, all the best.
Thank you very much. And apart from the teaching and research, I am also taking care of the placements, and we are very aggressively doing placements every year. We do a lot of canvassing to different hospitals and companies. Last year there are 8 companies visited this institute for campus placements, and we sent our students to 8 other companies, and all PharmD first batch students, except those who are interested to pursue higher studies in abroad, every PharmD student got placed, and we are able to place 50 BPharm students in different companies. But most of them again they joined in MPharm once the admissions are happened, and that is why what I am saying is now why I am telling about placement is one of the basis for the placement is expressing about ourselves, that we will meet when we participate in clubs, and those clubs and the club in charges will introduce now themselves. Thank you.
Academic rules, one correction is there. Though it is given by PCI that non-university examinations like communication skills or remedial biology, remedial maths, Osmania University give the question paper as well as the correction will be done in the university only. So it's a university exam. So that's the correction I want to say. Thank you.
Good afternoon everyone. So now we have seen so many subjects, so many faculty who are all pharmacy professionals, right? So I am the only one who is non-pharmacy teaching here, and I joined way back in 1997.
So you can imagine why I'm here so long, right? So that shows that how comfortable I am here in this institute. So I joined in 97. I almost have 25 years of experience of teaching. And then most of you, I don't know whether you are aware or not, you have mathematics. Okay, so that is there as one of your subjects in your first year, and don't worry about it. So as you have done till 10th class, you have done your maths, right? So you will be going through this subject in the first year again. So I am going to take care of that particular subject for you. And not only that, I'll be taking some other subjects like statistics, which is related to pharmacy, so which is called as a biostatistics. And then I'll be taking computers also for you. So on the whole, I can say that all the non-pharmacy, basically whatever is there other than pharmacy, so I'll be taking care of it. And you might be wondering why I'm wearing this white coat, right? So this is a pharmacy coat, right? But I'm wearing it because I'm into the pharmacy family for the last 25 years. So I feel honored to wear this. Instead, even though I have not done my pharmacy profession, I have been wearing this. I feel honored to wear this. And I welcome all of you to our college, and I assure you that this college is a wonderful college. I feel that because I've been here for so long, right? So I know the intricacies of every aspect of this college right from the 1998, 97. So though we started in the year 97, actual classes were started on 98 January. And if I remember, if I'm not wrong, we started with only 3 faculty at that time with one batch of B Pharmacy. So later on, now you can see how much it has expanded. And with the visionary of the management, now the building has become very, almost like a 5-star facility, right? And then we'll enjoy every moment in the college with all the management and principal, director and vice principal, with all their guidance and all our guidance, though I'm also a senior faculty here, so I can also guide you through whatever you require, right? So whatever you require, I'll be definitely guiding you people, and then any help from anywhere, anytime, I'm ready to give you. And then I once again want to tell you that don't worry about the subjects. So I know BIPC students are all worrying about the maths. So thinking that maths will not be there in the pharmacy, you must have joined. But unfortunately, okay, so it is there in the maths, it is there for you, but I will take you through it, okay? So thank you very much, and I thank all the parents also for waiting so long till 4 o'clock, okay, to patiently waiting and listening to all of us. Thank you very much.
Thank you, madam. It is true that we were all afraid for mathematics because it was first time in this college. Ma'am helped us a lot in mathematics.
But we all got A grade in mathematics after our first sem. It is all because of her.
Thank you, ma'am.
The way of teaching is very interactive and very
Even before entering the subject, we will be afraid to just read the name also. Mathematics. Okay. Ayyo, Pranita, look at everybody. They have become so dull. Where is the energy? Where is the smile?
Don't worry, Lisa. We'll add charm to their faces by introducing club activities conducted in our college every Saturday.
Yes, you heard it right. Club activities is conducted in our college every Saturday from 3 p.m. to 5 p.m. because our college believes in making a student all-rounder, not just in academics but also extracurricular activities like dance, singing, many more which are waiting for you. So now let us call the first club, Sports and Fitness Club in charges, Apurva and Srinidhi from B Pharmacy 4th year. We all know the importance of being fit and also how sports are helpful in our life. So I call upon them to give a brief introduction.
This is Srinidhi and I am from B Pharmacy final year. Today I am here to discuss about sports club. As we all aware of the fact that sports help us in developing the mental health and physical fitness of the body. In addition to it, we can gain various skills, experience development. I would like to inform that our college provides separate sports sessions once in a week. Our management provides many facilities for games which include both indoor and outdoor games. It gives a better opportunity to many of us, not only to learn new skills and improve better skills. Thank you. Have a good day.
Everyone, my name is Apurva. I am from B Pharmacy final year and I am the in charge of fitness club, and that includes gym and yoga. Firstly, I want to talk about yoga, which is an ancient practice in India. Yoga is not restricted to any age group. It can be practiced by anyone at any stage. Daily practice of yoga will boost our immune system and helps to cure diseases without use of medicine. Yoga improves physical and mental health. Next, about gym. There is nothing more important than health. We are healthy and fit. If we are healthy and fit, we can enjoy our lives. Practicing gym can lead to relaxation. In this club, we practice yoga and workout in gym to keep ourselves fit. We have many equipments related to gym in cellar. Join this club, precious, and stay healthy. Thank you.
Guys, do you got a hint which is the next club?
Did you get the hint? Oh, yeah, it's right.
We invite B. Saipria and Mamata to introduce about music and dance club.
Wow, Mamata, what a beautiful voice. We expect few more singers into our class. Hello everyone, myself B. Sai Priya
and myself M. Mamata.
We are representatives of Music and Dance Club. As we know, culture club activity includes dance, music, karaoke, instrument, whatnot. Culture club activity is not only club for entertainment, but also it gives you a mental. Now it's time. We give a chance to explore yourself, where you can become a stage performer. Now, I'm going to pick up someone to sing a song. From where should I start? Okay, don't panic. I'm not going to pick up anyone. Everyone just got panic, right?
To overcome this panic, you should be part of the club activities. In our busy life, we need a little break to overcome stress, and for students, it is the academic tension. It is a place where you can dance, sing, enjoy with your friends. It is also a place where students can showcase what they have got. It helps to discover these talents. Cultural activities increase the confidence levels of students and allow them to perform even better. So joining clubs, which is favorite part of you, later. Show what you are and make college life memorable with your friends. All the best for your new college life, and hostlers, be ready to experience a great part of your life. Thank you. Have a nice day.
Arey Pranita, you know, there was one plane that disappeared from sky, and it came back. You know, I was there in that plane.
Oh Lisa, stop, you're such a drama queen. I know there are many drama queens here in this auditorium. If you're a drama queen, come and join the Thespian Club. Now,
Thespian Club is a theatre, skit, and also
drama club.
Yeah. So all the people who have the talent of skit or drama, you can exhibit here. So I call the club in charge of Thespian, Danyata from Farm D 3rd year onto the stage.
To all those wondering what thespian means, don't worry, I'm here.
Good afternoon to one and all present here. I am Dhanyata from Farm D 3rd year. The word thespian is just a fancy word used to address an actor or an actress in honor of the great Greek playwright and performer Thespius. So let me start up by giving you a brief introduction to our club. The Thespian Club aims to bring theatre to the people. If you think acting or directing or writing a play or even creating a set isn't your forte, we are here to make you think again. With a range of activities covering all aspects of theatre at the beginner's level and also intermediate level workshops, it aims to make everyone believe that theatre is fun for everyone. The Thespian Club has a wide array of activities suited to everybody's tastes and promises. Theatre Club helps members communicate their thoughts in front of an audience and in short films, shows and dramas. Many of the students who joined the theatre club were introverts, but participation in the club made many of these quiet, shy students to perform their talent in public, which would have been too nerve-wracking for them previously. The very recent accomplishment by our thespian club members is their active participation in the 61st National Pharmacy Week that was held from 19 November to 26 November. A total of 7 groups containing 5 members each have directed, produced and created 7 fabulous short films under the guidance of our faculty. The main objective of our club is to encourage the students to get creative and wild with their imaginations and to make them confident enough to implement their ideas and create magic. Apart from what is already being practiced in our club, we are also planning for intermediate level workshops to make this current and the upcoming academic years even more fun. 2 of these plans include vernacular theatre and script writing workshops. Noting the interest of many students in regional and vernacular theatre, the club is planning on gradually expanding its reach from spoken English theatre to other languages. The script writing workshop is for those individuals with the spark of storytelling but find it difficult to articulate their ideas. The workshop maximizes the benefits for those who seem to find it difficult to express their stories. The script writing workshop will help students identify aspects of storytelling, characterization and narratives to ensure that simple ideas can be converted to interesting scripts. With this, I would like to conclude, and on behalf of our entire theatre club, we welcome you and wish you a hearty congratulations. Thank you.
Is there anyone?
I can see there are many people interested.
There are many people interested. There will be tough competition, I think.
Yeah, Farid, it is very tough to compete with them.
So you are at the right place. If you are interested in arts, quiz, debate, then you must join the club Fine Arts Debate and Quiz, whose club in charge is.
I now invite Amulya from Family 3rd year to introduce Fine Arts and Debate and Quiz Club.
Good afternoon to everyone. I am Amulya of Family 3rd year. A heartily welcome to Vanita family. Today I am going to introduce you about Fine Art, Debate and Quiz Club. Art is a desire of a person to express, to record the reactions of their personality to the world. A campus with scientific thrills requires a balancing dose of art so that the aesthetics and the beauty around us are not forgotten. Club started off with ambitious plans last year which gave good results. The motto of the Fine Art Club is to inspire, enable our students to actively learn and develop their talent and skills that will develop artistic expression. Vanita Art Club gives our students broader view of art and many other forms like painting, poster designing, clay modeling, cartooning, pencil drawing, etc. The college is primarily concerned with preparing and promoting students who have taste and potential for various art performances. It also encourages participation of its members at inter-college competitions during National Pharmacy Week celebrations. Students have unique ideas and powerful imaginations and need space to work through their artistic expression on their own terms without any objectives and boundaries. By hosting an art club that allows for free expression from students, they can feel open to experimenting and creating from their imaginations. Together, we learn that mistakes happen, but here in our art club, they are called happy little accidents. Debating and quiz competitions are a fantastic way for students to meet their interested and argumentative students, develop their confidence and analytic skills, and spend a whole evening or a day improving at debating and answering skills. Its main motive is to promote radical thinking and intellectualism among the youth. Our college provides quite the right platform to start the debating season for budding debaters and quiz competitors. The main objective of this club is to encourage the students in various art, debate and quiz activities and to help the students develop their abilities. So once again, we welcome all the Kalakars who are outstanding there to come and join our club. Thank you.
Pranita, this music, dance, drama, arts, sports, fitness, all clubs are there, but I am very afraid for future, right? So how to crack the interviews, Pranita? Do you have any idea?
To crack an interview, I think we need to have good speaking skills, good communication skills, and we need to have good leadership qualities. Don't worry, Lisa, in our college we have a group discussion club where you can learn everything.
Oh, so you recommend me to join that club?
Yeah, of course. I recommend juniors also to join the club.
We will definitely meet in the group discussion and oratory club, so that you are not my competition anymore.
No, juniors will be your competitors now.
We invite all the students to join group discussion and oratory club, which is conducted by Sonia of Family 3rd year. Please give a little information on that.
You are braver than believe. You are stronger than seem. You are smarter than think. By these lines, myself Sonia, Family 3rd year, and you are wholeheartedly welcome to Sarojini Naidu Vanita Pharmacy Mahavidyalaya. And good afternoon to everyone present over here. What is the group discussion? The group discussion in your life will enable the thinking, listening and speaking skills, which also improves your confidence level at the peak of the mountain. And this is the platform where you have to prove yourselves, because you are the master of your own life. And this is the platform where you can able to improve your speaking skills and also decision making, and also you have an academic success. The term oratory refers to the mastery of the public speaking, guys. And there are 3 tools for this. They are enthusiasm, charisma and spiritualness. What is the use of oratory in professional life? Is nothing but confidence, enthusiasm and ability to inspire others, and also the influence. Because this is the platform, this is the only platform that you have to prove yourself and to have a good developing communication skills and to boost your confidence levels. And finally, I want to say that there is only master word of our club is confidence. Because confidence is such a beautiful thing a woman can wear, and beauty is just incomplete without confidence. So you are wholeheartedly invited to this club with no limitations, with no fears, with no restrictions. So have a memorable day and thank you.
This era is very full of lifestyle disorders like diabetes, obesity, PCODs. So women need to be very strong, because she is the pillar of a family. If she is good, whole family will be good. So here in Sarojini Naidu Vanita Pharmacy Mahavidyalaya,
we have lifestyle and anchoring group. Anchoring, if you listen the word anchoring, what hits your mind? Suma, I heard Suma, Bharti Singh. If you are one of those Sumas, Bharti Singh or first Pranita or Lisa, then definitely join this lifestyle and anchoring group, because you can exhibit your skills. This is a platform where you stand and hundreds of people will know your name. So that's why I recommend all to join lifestyle and anchoring group, whose club in charges are Nilofer and Neha from B Farm 4th year to speak a few words on this.
A very good afternoon to everyone. This is Neha Kausar.
Good afternoon everyone. This is Nilofer.
We are from B Pharmacy final year. Hello everyone. Today I am here to give voice about Lifestyle Club. Lifestyle is the way that you live. It is an individual perspective. It is feeling good about yourself, taking care of your health, which is important for building your self-esteem and self-image. Leading a healthy lifestyle is an important part of our lives. One should follow a healthy life regardless of their age. There are a lot of ways of being healthy. Few of them includes conscious in diet, surrounding yourself with positive energy and self-care. Being healthy means that you are physically and emotionally fit. It might be a little bit difficult to change your old habits and switch to a new healthy lifestyle, but you can take small steps and change your lifestyle. The main motto of our lifestyle club is to reach out maximum people and make them fit, to give tips about lifestyle, create more awareness, teach everyone how easy it is to stay fit and move all together. Thank you.
The way communication has evolved in today's world, traditional principles, practices, public speaking, presentation and negotiations no longer apply. Anchoring is one of the greatest significance in the present era, and an exuberant presence of an anchor can elevate the glory of the program, right? Anchoring Club chisels the skill of anchoring in members. Club nurtures and trains the students into an elegant, confident anchors. The club members take up anchoring in every college event. The club emphasizes upon a graceful way of presentation, extemporaneous ideas, language fluency, pronunciation, confident gestures, and to mold you into an amazing anchor. Therefore, here we upskill members by tutoring modern tips and tactics and strategies in order to develop a dynamic and fearless leaders and anchors. So we are here
to invite you to our club and hope you all see there.
Thank you.
Thank you everyone.
बनी कुछ ना कुछ तो छूटेगा, इसलिए जहाँ है वही का मजा उठाते. Can you guess the movie name?
Yeah, Ye Jawani, right?
Oh, filmy.
Yeah.
Do you know any dialogues from any movie?
Tagge dele.
Oh, Pushpa.
Yeah.
Very famous dialogue, right?
Anyone want to say any dialogue?
Of any movie, any hero, heroine, even parents,
Even faculty.
faculty. We need involvement.
This is what club activity is meant for.
So that if you have any of these skills, don't sit there. Come up, or we will come and give you mic. Any movie, raise your hands. Faculty. Oh, still you have chance. Anyone? One dialogue. Just one dialogue.
Okay, we'll go.
As you know, I'm fond of Bollywood, so I can say Tangavali, Itta Varadi.
At least claps, yaar. What is this, yaar? No involvement. One dialogue. Ek. Last time I'm asking. Madam. Oh, come.
Good afternoon, everyone.
Good afternoon.
Because zara sabar karo.
Rajeshwari ma'am. One dialogue. Girls, opportunity is leaving.
Flower and fire.
Instagram. First years after they join this college, no, they'll not allow us to stand here also. But now they're not speaking. No problem.
We want at least one student.
कुछ होता है तुम नहीं समझोगे. शाहरुख खान फैन.
No one will. See girls, see and learn.
Nobody, girls, we will see you. Definitely. Clap will start. No, one by one I'll ask to come and say dialogue. And one dialogue. No problem. So now I invite Brighty from club in charge of film and appreciation, family 4th year, to speak a few words. This club where you can deliver dialogues is called film appreciation club. There is a girl who wants to speak, say dialogue.
Hiranmai from Michi movie. వీలైతే ప్రేమిద్దాము డూడ్ పోయేదేముంది మహా అయితే తిరిగి ప్రేమిస్తారు.
Very good, very good.
Good afternoon, everyone. Myself Spandana Brighty of Family 4th year. I heartily welcome you all, especially B.Pharm and Family freshers, to Sarojini Naidu Vanitha Pharmacy Mahavidyalaya. I'm here to give an insight about film club that we have. Films can be used to entertain, educate, or explore important social issues. Films have the power to sit up and take notice, learn about a new culture, experience a different perspective, or open our eyes to a world we know nothing about. Let us know what's the importance of films in education. Films that address the topics that we, the students, study in college are just as effective as the teaching materials. They see the world from another perspective or provide teachers with a new tool to enrich the lessons. Films take us on an adventure, whether it is a story we never considered, a vision of history from a specific lens, or a lesson that we never knew we needed to learn. So what exactly we do in a film club? The film club is a great way to explore many films and study films as an art. The club was formed to inculcate a sense of watching films among students. The aim of the club is to train the students to become active viewers of cinema. The club is developed to nourish students with the ability to create their own film projects. It updates the knowledge of students about various perceptions of films. Film Club provides workshops, seminars and webinars for the students to develop skills in editing, filming and writing. Students are also given opportunities to create their short films. Moreover, it is a fantastic launchpad for the student aspirants in the field, exposing them to liberal arts and critical thinking. While film appreciation is about more than just critically acclaimed films, it is good to start with the most groundbreaking types of films in every genre. I would now like to conclude by saying that the film is a reflection of society and in most cases has the ability to be a mirror and not just show the problems but also give solutions and help them reach a large number of people through faces and voices that matter. Thank you.
Thank you, Brighty. Last but not the least, there is a very special club called as Mitra Club.
Now I invite Hana and Ashmita from Family 4th year to brief you about Mitra Club.
Good afternoon, I'm Hana Mariam Khan from Family 4th year.
Good afternoon, I'm Ashmita Sunkara from Family 4th year. Before starting, we would like to extend a very warm welcome to everyone present here today.
I know, it's a very special day for you all and you're going through a lot of emotions like happiness, nervousness, excitement. We know, we understand. Been there?
Done that.
So don't worry, everything will be great.
Trust us, it will be a beautiful journey and a memorable one. We all have our own shares of ups and downs, might be related to academics or personal issues, which can get very overwhelming.
Anita? I'm very sad, Ray.
Why?
See, look at them. It's a starting phase for them, and it is ending phase for ours. Like they are in 1st year and we are in 4th year. We will leave this college, but you know there are lots of memories that is stored here.
You want to share anything about your experience in this college?
Yeah, you remember fighting in mess
and for extra snacks.
Talking with madam.
Yeah, gossiping about our friends.
Yeah, there are so many memories. In the same way, to share the experiences, memories, and what are the different facilities in our college. We invite Miss Ba from Family 4th year to share her college experience.
First of all, good afternoon everyone, and I heartily welcome all the freshers to this SNVP MD, Sarojini Naidu Vanitha Pharmacy Mahavidyalaya. And this is genuinely my personal experience in this college. I hope you will discover the college as soon as possible, and I congratulate and best wishes for your next adventure. You have entered a lively, challenging college. So, first of all, I would like to say this institution gives equal priority to the academics as well as extra and co-curricular activities. Like club activities. In club activities, we can know what is our strength and we can explore what are our weaknesses. We can work on it. Because of these activities, I built so much confidence so that I can speak in front of so many people. So, and I would like to say that our college is very proactive. Because of this activeness, they have encouraged us to take part in National Pharmacy Week, and because of this, we have won many prizes, knowledge, experiences and memories. And one more thing I would like to add is that because of this, we have gained knowledge. Because of seminars, they have called very well experienced speakers, so that we have gained a lot of knowledge during seminars, and I'm really very happy to say that Sarojini Naidu is the only college in Hyderabad which set up the virtual pharmacy. So I'm very glad, and many of the faculty members help us to improve our communication skills, counseling skills, and gain knowledge through patient counseling, especially for family students as well as B.Pharm. So because of patient counseling between seniors and juniors, so we can explore many things when we are learning, and they'll help us to celebrate special days like tuberculosis days and TB day, breast cancer day, so that they create awareness among people and the students. So I would like to respect, with a huge respect, I would like to thank all the faculty members, love and devotion. And this management is so supportive for us, which help us to do everything like what we are interested. And they take us to the exhibition ground and Nampally, exhibition Nampally, Numaish, like for free funds are given by the college people for rides, stalls, etc. for fun activities. On Women's Day, they took us to Wonderla for relax our minds, and we need not to worry about food and snacks because they are easily available through vending machines and mess. So I'm very glad to be the part of this college, and it gives me a homely feeling. Thank you.
My first class which I heard is pharmaceutics. That first class was, yeah, I came here, like you people might know that some people think I want to do MBBS, but I came here to do B.Pharmacy because you didn't get into that MBBS, right? Many of you people think like that only. So, but after listening to that class, I got to know that pharmaceutics is not, like pharmacy is not less than anything. My first class was said by Prashanti ma'am, and I really felt that, like if my every class is like this, I'll come every day. And then, like, as it is my first class, like, I'm thinking from then only that I need to do my specialization in pharmaceutics, like the thoughts will come to you. So I wish you also need to find your like interested subject from the next day you enter the classes. That's all, guys. We invite Neha and Nilofer to share their college experience from B.Pharm 4th year.
Neha Kausar, I'm from B.Pharm 5 year. Today I'm here to share my experience in this college. Before sharing my experience, I would like to say a few points about the college. College is a collection of diverse people, new experiences, and learning how to be an adult. The college phase is one of the most interesting stages in life that gives you an opportunity to explore. It is a beautiful and perfect blend of joy and hardships. Once you get into a good college, you do get the opportunity to become an artist, which you always wanted to be. To share my personal experience, first I would like to start with my first day of the college. I was a little bit nervous by seeing it was a very hectic day where I felt whether I'll fit in this college or not. Why? Because we should introduce ourselves to many of the people, and you will meet many new people where you feel a little bit nervous. I was also nervous on that day. And about academics, I don't know whether I can say this or not, but I felt from my side I have developed very lot skills by joining into this college. And when it comes to academics, I would like to talk about our faculty members who encourage ourselves. And even today, I am here because one of my faculty forced me to do this, and I am thankful, ma'am, to giving this opportunity. And I want to talk about practicals, where we spend most of the time in the practicals lab. I still remember where in B.Pharm first year, we were like doing practicals and measuring drug particles, where we felt madam will scold if we not do correctly. But when I came to 4th year, I matured in a way that even if a 0.g or 0.mg changes will decrease your standard quality of the product. So that's the maturity I gained here. And apart from academics, our college will provide more curricular activities, which I would like to include, that is club activities, where we can learn more things and explore more. And recently we have gone through National Pharmacy Week, where most of my friends enjoyed a lot and we learned a lot. And my B.Pharmacy course is not complete without lockdown. We spent most of the online classes, but when we came back, Our management took a great initiation to retake the labs. I'm thankful for their management and also faculty who are doing that again. And about friends, I made very pretty good friends here. And अगर infrastructure के बारे में नहीं बोला था, कुछ भी नहीं बोला. I was like, Neha, you are studying in this college for 4 years. क्या building है? And this was my complete experience up to now. Thank you everyone.
Good afternoon everybody.
This is Nilofer. I'm from BPharm final year. The world opens to graduate the moment we get out of the college. All of us think the same way. Here in this institute, they develop you. They teach you to how to survive in that world. You know, college has many advantages for us in our later life. Here in this institution, we are allowed to explore our interests and to find the path which is right for us. Now, during the National Pharmacy Week, we participated in various events. We were encouraged by our faculty, our lecturers that if you participate, if you don't win also no problem. You will have experience which you will remember for lifetime. And that is all matters, right? So, we participated in various events and which helped us to work towards our betterment in our subject as well as to develop our personalities in many ways. And I really thankful for our lecturers and faculty because without them we are not, I am not here because everyone is so friendly enough. They're always a text and call away. You text them before exam, if you call them before exam, ma'am I'm not understanding this, ma'am I have doubt, no problem Nilofer, I'll text you the answer, I'll explain you the way you stay on the line, or you call me after 5 minutes, they'll obviously explain you and they'll not hesitate or they'll not keep quiet or anything. And the other thing is the club activities. Saturdays are always fun to come to college and attend club activities because everybody, including faculty, students, everybody take part in it and make it a success. And obviously friends and people around us matters a lot to us. If we are around good people, our personality also develops the same way. So everyone here is very friendly enough and we have mentor-ment interaction and every students are assigned mentors and their mentors are very friendly to you and they help you to resolve your problems, not only through subject or difficulty in academics, but anything, any personal issue also they'll solve your problems. You can just go to them and talk to them and share your things. And the other thing is I would like to thank everybody for who are we because of you all only, ma'ams and sirs. And I've met my classmates and juniors, seniors, everybody is very friendly enough. And thank you.
Before ending this student's experience, I will also like to say a few experiences or few things. You know, I am a hostler, okay? And I am a hostler. Yeah, we both are hostlers. So those who are, how many are hostlers here? No hostlers? Okay. So we have to report to hostel early, right? So I was so excited to experience this college life. Everybody, in movies we have seen, right, how college life will be there. So I was very excited. I brought everything from my home, but I forgot to bring my bag of books. I brought everything. Books filled with bag was all at home. I was very panicked what to do now. First day of college, what madams will think? There is no book, she has come like that only. So there are some instances that will happen in our life. We should learn from it. Also, one more thing, our college will encourage in everything. You should not feel burdened that why always madam will say to do this, to do that. But by doing that only, it's an opportunity that we have to take. Every class you have to listen, because now when we are coming in 4th year, we were asked to choose the subject for project work. 1 year will be project work, right? By now, by 4th year, you should be very much clear that which subject you are interested in, so that directly you can choose that particular subject and do your project work there. Do not miss any classes, because if hostlers are there, they'll use that opportunity to sit at hostel. So don't miss anything, everything is important. In 4th year, we will feel, arey, this subject, what we did in that subject, we'll regret it. So instead of regretting, at every moment, utilize that opportunity. This was my experience. Now before moving, giving this mic or stage to Srinivas sir, I am Lisa Patel.
And I am Pranita
from B Pharmacy 4th year, signing off. Thank you.
conclude this event. From tomorrow onwards, the classes will begin, and the college time, as all of you know, 10 to 5 o'clock. And library timings 9:30 to 7:30. And hope our students and faculty have enlightened more about the profession and all that. Still, anybody has anything to say, you are welcome. And anything missing? Faculty members, anything that we did not update them? Yeah. Just now I heard students saying that Saturday is full of activities. Saturday it is 3 to 5. Only is about the club activity. It is only 3 to 5. Then how does the personality develop? Just weekly 2 hours? No. Actually, you have some 5 theory subjects in a semester or in a year for Form D people. So for each subject, 4 theories will be there per week. Normally in all places what happens is all the 4 classes are utilized for covering the syllabus. But as per AICTE or PCI, it is not like that. 3 classes are for covering the syllabus. Is it audible? 3 classes are for covering the syllabus. 4th class is called as tutorial class, where we have to evaluate whether they have understood. We conduct some group discussion, we conduct some short 10 minutes seminars or some role play exercises. So it is a revision of what is covered in the first 3 lectures. So the students will not have a bullet train sort of experience, completely 4 theory, back-to-back lectures. No. After every 3 lectures, there is a revision lecture. So even if some students for some medical or some reasons, if they don't catch up, even if they are coming to college, that 4th lecture can be utilized by students to understand what they did not understand in the first 3 lectures. So there will be an opportunity for students to interact in the 4th lecture. In student experiences, anybody has, Lisa, their work is over, they have gone? They just ran off, okay. But they didn't say anything about the 4th tutorial class? Mamata madam said. Okay. So 4th lecture, the students, if they are really having some problem, they have to express their problem. We can't scan the body and see that, okay, this subject, this topic is not understood. You have to tell us. Okay. If you don't tell us in the first 1 month or first 2 weeks, then you will not understand in the next 3 weeks. If it goes to 2nd month, without understanding the first 1 month, whatever is lectures happened, then you start hating that subject. You start developing a phobia for that subject if you don't understand. So that should not happen. In the very 4th lecture, you come out and say that this I did not understand. At the same time, I am not asking like school children, A class, the A class chadavali ani nenu cheptalenu. Okay, but at least read to the extent of understanding what you did not understand. అంటే మనకేం అర్థం కాలేదు అనేది కొంచెం తెలిస్తే చాలు. That you can say to the faculty that this I did not understand. And every day labs will be there. Lab consists of at least 3 into 50 minutes. Continuously for 50 into 3 minutes you won't work. So in between, when you get some time, you interact with faculty in a friendly manner. Tell them that I am not able to understand the English that you are going a bit fast. Now I am speaking at one pace. 50% of the students, I am sure they did not catch. Okay, so that you have to ask in the lab hours and then take the clarity. ఇట్లాంటివి చాలా ఉంటాయి. అండ్ పేరెంట్ టీచర్ మీటింగ్ అనేది జనరల్గా ప్రొఫెషనల్ కాలేజెస్లో బీటెక్లు బీఫామ్ల్లో అవ్వవు. वो नहीं होता. But whenever you give a call to the principal or vice principal or me, that is a parent-teacher meeting. Whenever you are free, when you come to college, whenever you are free, when you come to college, you can discuss about your daughter's progress, academic and non-academic matters. Non-academic matters are what? Whether they are reacting properly or they are more short-tempered or whatever. Okay. So it's up to your convenience. Whenever you want to come, you come. That time we will discuss thoroughly about your daughter's progress. Okay. Anything you want to say? So you had a long time from 10 to 4 o'clock almost. So I thank one and all for coming to the college and knowing about our institute. And I expect full attendance from all the students. As all of the students and faculty have told, it is not just the academics what goes around, but lot of activities. We conduct lot of conferences. Last month we have conducted 2 conferences and 2K run happened, I think you must have told. And next January we may be planning college annual day. And March we have already finalized one international conference which will be organized in exhibition grounds in Pandal, which accommodates 1,000 people or 1,500 people. So we are going to have an international conference in association with our chairman sir, that is IPA Association Telangana State Branch. So in all these activities, we will be involving the students. Okay, thank you very much. Thanks one and all. I thank the volunteers, and one student I have seen, without telling this it is incomplete. And in Telugu she is telling, ఇది చెప్పకపోతే complete కాదు. Hindi also she is telling, इसके बोले बिना ये complete नहीं. In the same way, और एक बात अगर हम नहीं बोलेंगे तो it's not complete. That is, we don't have any sort of ragging sort of issues. Am I right? So even if there be any small issues, face it boldly, talk confidently, and convey me. Okay, in the group that we have created, WhatsApp group. Now lot of faculty are there and our Sridhar sir is there and all that. So we will be removing all people. Only I will be there. That's all. Along with all the students. There will be WhatsApp groups of individual classes along with class in charge and all that. To have some privacy, to tell openly if any problem is there, that WhatsApp group is going to be active. Okay, no other college staff except me. If you face any problem, always you can ring up our principal madam. She is very student friendly madam, Sarita Joshna madam. And we have Mamata madam. And class in charges anyway are there. If you want to discuss directly with me, you can ring me. Especially after 6 o'clock, I will be more free. And you can WhatsApp me also. There will not be any issues. There were no issues, but this time there can be issue. So we have to be very cautious. So far we did not have any issues. But that doesn't mean that we don't take care every year. Okay? So every year we take all precautions to ensure that there is no sort of interaction sort of things or telling the student you have to say madam, you have to do this. Atlantivi mavavu. Okavela aithe ganaka you come to us, we'll solve. But don't panic. Okay? They are very friendly. Maybe Lisa is getting hurt when I am saying all this. But it is a routine matter. It's a routine matter. When you were in first year also, we were telling the same. All precautions we have taken. Okay? Parents can be absolutely confident that nothing happens here. No sort of ragging, no sort of interaction. And one point contact, you can have a chat with me. We will resolve. Okay? Thank you.
Floor. Thank you.